diagram in your books, guys. So just observe the diagram right now, okay? Brachial plexus is going to originate from C5 to T1. So somewhere in the middle here we'll be having cervical spinal nerve C5, C6, C7, C8, and the first thoracic, that is T1. Then I told you that the brachial plexus will be having 5 parts. Number 1 will be having like roots, and the roots will combine to form trunk, and the trunk will divide into division. Divisions will combine to form cords, and cords will finally give you the branches. So these are totally 5 parts of the brachial plexus. Out of that we have learned about the roots. The roots will be nothing but again the same thing only. Whatever origin that we have learned, C5, C6, C7, C8 and T1. So whatever origin that we have learned, that itself is nothing but the root. How will be the trunk form, guys? C5 and C6, these two will combine to form the upper trunk. And then the C8 and T1, these two will combine together to form the lower trunk. And finally C7 will continue to form the middle trunk. And we'll be having like 3 trunks: upper trunk, middle trunk and the lower trunk. And once you are done with these 3 trunks here, the next thing, division, is the easiest one. All the 3 trunks will divide into 2 division: anterior division and the posterior division, anterior division and the posterior division, anterior division and the posterior division. So that is the easy part. Now welcome to the difficult part. The posterior division of the upper trunk, the posterior division of the middle trunk and the posterior division of the lower trunk, all the 3 posterior divisions will combine together to form posterior cord. तो पहले आप क्या करोगे? First you are going to combine all the 3 posterior division of the upper trunk, middle trunk and the lower trunk. All 3 posterior divisions will combine to form posterior cord. Now you are left out with the anterior division of the upper trunk and the anterior division of the middle trunk. These two will combine to form lateral cord. And the anterior division of the lower trunk will just continue to form the medial cord. So in total, how many cords do you have? You again have got like 3 cords. तो पहले आप क्या करोगे? एक बार फिर से हम लोग रिवाइज करते हैं. वर्थ रिवाइजिंग. First, the posterior division of the upper trunk, the posterior division of the middle trunk and the lower trunk will combine together to form posterior cord. The anterior division of the upper trunk and the anterior division of the middle trunk will combine to form lateral cord. And the anterior division of the lower trunk will just continue. It will continue to form the medial cord. Lateral cord, medial cord and the posterior cord. Then we have learned that the lateral cord will actually give 3 branches with the mnemonic L, M, L. And medial cord will give you 5 branches with the mnemonic as M, 4, U. And finally the posterior cord will also give 5 branches, that is lunar. तो हमने ना कल डिटेल में ऑलरेडी ब्रांचेस के नाम लिखा था. And now I told you yesterday what to do. The easy trick right now, guys. Try to remember the major nerves actually. M for musculocutaneous nerve. Musculocutaneous nerve. ठीक है? And A here for axillary nerve. And R here stands for the radial nerve. And then U here stands for the ulnar nerve. Okay, so till now I'm done with the 4 of them. And I told you yesterday already, okay, how many major nerves do you have, guys? You'll be having like 5 major nerves. Now here there will be lateral root of median nerve. And here there will be a medial root. हमने लिखा था यहाँ पर medial root. I'm not writing like all the branches right now. Why? Because yesterday we had a very nice discussion yesterday in detail. तो lateral root of the median nerve and the medial root of the median nerve, ये दोनों मिलकर क्या फॉर्म करते हैं? median nerve फॉर्म करते हैं. So whatever, in total how many major nerves do you have, guys? You'll be having like 5 major nerves. 5 major nerves: musculocutaneous nerve, axillary nerve, radial nerve, ulnar nerve and the median nerve. I repeat again: musculocutaneous nerve, axillary nerve, radial nerve, ulnar nerve and the median nerve. They are the 5 major nerves. And please keep in mind one more thing from this diagram here. Today we are going to discuss in depth right now actually, guys. So please pay attention here right now. This is like yesterday in the evening, I think I stopped a little bit earlier at 10 o'clock or 10:15 like that. Why? Because that was an important part about the major nerves. तो मैं आपको ना आज freshly discuss करना चाह रहा था. So I want everyone to concentrate here in the first section. अच्छा, एक और चीज़ यहाँ पर सीख लो. Musculocutaneous nerve is going to originate from where? It's going to begin from where? From the lateral cord. Okay. Axillary nerve and the radial nerve are going to originate from where? They're going to begin from the posterior cord. Okay. And then ulnar nerve is going to begin from where? It's going to begin from the medial cord. चलो ठीक है. Now what about the median nerve? Median nerve is going to originate from where? It's going to originate from both your lateral cord as well as from the medial cord. Understanding? So in this diagram itself, you are able to even learn the origin of the nerves. कि कौन सी nerve कहाँ से originate होती है? Which nerve is going to originate from where? ठीक है? So this is like a little bit revision of the brachial plexus. And we have to now concentrate today on all the 5 major nerves. Come on. Once you are done with this brachial plexus revision, now the next thing that is the most important thing, the golden rule I gave you yesterday. In total, you'll be having, major nerves. How many major nerves do you have, guys? You'll be having like 5 major nerves. I told you in the arm can be divided into 2 compartments, anterior compartment and the posterior compartment. Forearm muscles can also be divided into 2 compartments, anterior compartment and the posterior compartment. And muscles of hand are not divided. Is it okay? So just look at me here right now, guys. Upper limb, anterior compartment, all the muscles are divided. Arm, all the muscles are divided into anterior compartment and the posterior compartment muscles. And in the forearm, muscles are divided into anterior compartment and the posterior compartment. In the hand, you yourself can touch and see here. Behind you don't have any muscles. पीछे यहाँ पर कोई muscles नहीं है. You just have the muscles anteriorly here, right? Understanding my point here right now? So therefore, we are not going to divide the muscles into 2 compartments in hand. Okay, only muscles of hand. So I repeat once for the last and final time. Arm, anterior and posterior compartment. Forearm, anterior and the posterior compartment. And in the hand, only muscles of hand. Perfect, done. Now I told you the rule yesterday. Try to remember my rule, learn in my way. All the muscles in the anterior compartment of the arm are supplied by musculocutaneous nerve. All the muscles in the posterior compartment of the arm will be supplied by radial nerve. Not only posterior compartment of the arm, even posterior compartment of the forearm will also be supplied by radial nerve. So the entire posterior compartment is supplied by radial nerve. The anterior compartment of the forearm is supplied by 2 nerves, ulnar nerve and the median nerve. And the same ulnar nerve will continue and the same median nerve will continue. They are supplied to muscles of hand. Okay. So try to make a picture like this from today onwards in your mind. Musculocutaneous nerve here, radial nerve here, radial nerve here, ulnar and median here, ulnar and median here. I hope it is very clear. So all the muscles in the anterior compartment of the arm will be supplied by musculocutaneous nerve. Okay. And the posterior compartment will be supplied by radial nerve. Anterior compartment of the forearm is supplied by ulnar nerve and median nerve. And the posterior compartment of the forearm is again supplied by radial nerve. I told you, entire posterior by radial nerve. And the muscles of hand are again supplied by 2 nerves, ulnar nerve and the same median nerve. लेकिन अगर आप ध्यान से देखोगे, I told you in total how many major nerves do you have, guys? You'll be having like 5 major nerves. We are done with only 4 of them: musculocutaneous, the radial nerve, ulnar nerve, and the median nerve. The 5th major nerve here will be the axillary nerve, guys. Now axillary nerve is going to supply to only and only 2 muscles. I want you to remember them and once forever. Number 1, deltoid. Okay, that beautiful muscle which is going to give the rounded shape to your shoulder, deltoid muscle. And then one more muscle which is supplied by axillary nerve is teres, and that is teres minor, not major. Remember, teres minor. So till here we have studied yesterday. कल हमने ना यहाँ तक पढ़ा था. I hope everything has been revised now. And now today in the very first session, the most important one, I am going to deal with all these 5 major nerves. All the 5 major nerves we are going to discuss one by one. Musculocutaneous, the axillary, the radial, ulnar, median. And believe me, if you complete these 5 nerves, 80% of upper limb topic will be done. ठीक है? तो चलो sir, let's get started now without disturbance. First nerve that we are going to learn right now is musculocutaneous nerve. Right on the heading? Musculocutaneous nerve. Guys, from today onwards, always make a habit कि whenever you're writing or you're learning about any nerve, सबसे पहले आप लोग पढ़ोगे origin. And the good news here is that origin I don't have to teach you people. You can teach me right now, guys. Musculocutaneous nerve is originating from lateral cord of brachial plexus. Very good. From the lateral cord of brachial plexus. मैंने अभी आपको mnemonic बताया था LML. And in that LML, M stands for musculocutaneous nerve. And yesterday I think we have discussed about that brachial plexus everything almost for 2 hours. and you're perfect now. तो origin आपको already पता है, and in the bracket you write down the root value. Root value भी हमने कल decide किया था. It will be C5, C6 and C7. All the lateral chord branches root value will be C5, C6 and C7. Now after writing origin, my dear friends, in each and every nerve, always try to learn the supply. Musculocutaneous nerve supplies to which muscles? And even my students are expert in that one. It supplies to all the muscles in anterior compartment of arm. You also know the compartment. It is going to supply to all the muscles present in anterior compartment of arm. Beautiful. Okay. I request all of you to please look at my screen here right now, guys. If you learn in my way, whatever I'm teaching you the upper limb topic since yesterday, in my way, or all the topics in my sequence, you all know right now कि origin आपको already पता है. Everyone look at the screen now. We are learning about which nerve right now, guys? Musculocutaneous nerve. Origin आपको already पता है. Root value आपको already पता है. You already know the root value. And supplying to which compartment? You already know that. So everything written on the screen, other students will be like simply trying to mug up that one. Ratta मारते हैं उसको ना. Root value C5, C5 and all. No need to mug up. No tension at all on the brain. Origin पता है, root value पता है, and compartment also we also know. The only thing that you have to learn right now is that in the anterior compartment of the arm, which muscles do you have? If you learn right now, so right down there, in the anterior compartment of arm, you're having like 3 muscles. Okay, number 1, right down there, it will be coracobrachialis muscle. Number 2, our favorite one, that is the biceps brachii muscle. Biceps brachii muscle. And the third one will be the brachialis muscle. Okay. So coracobrachialis muscle, biceps brachii muscle and the brachialis muscle, these 3 are the muscles which are present in the anterior compartment of the arm. That's all, nothing else. And we are done with the first nerve, musculocutaneous nerve. बड़ी आसानी से. I hope in this manner it is becoming more clear, guys. So this is what they can ask you in the exam. Exam में यही आपको सवाल पूछ सकता है. Either they will ask you the root value, or they will ask you the origin, or they will ask you about the muscles which it is supplying. So it is supplying to 3 muscles: coracobrachialis, biceps brachii, and the brachialis muscle. I hope it is like very clear now. Now once you are done with the writing work here right now, I request all of you to please stop writing and look at the screen here right now, guys. Look at this diagram here right now. Now my dear friends, in this diagram you are able to see that this bone here will be the scapula. This bone here is the scapula. I request all of you not to write anything right now. कुछ लिखना नहीं है sir. Just observe the diagram and try to understand the diagram. Already in the group I have sent you the PDF file in which we are going to mark all these muscles in the images later on. हम बाद में mark करेंगे. अभी के लिए सिर्फ देखिए. Just observe here. Now this scapula, you can clearly see it is having a process here, and this process of the scapula is known as the coracoid process. That's the coracoid process of the scapula. And right from the coracoid process of the scapula, I can clearly see that there is a muscle beginning here, and this muscle is going from the side, and you can see the muscle is coming and getting inserted onto the humerus, shaft of humerus. Okay, that is the reason why doctors kept the name as coraco. It is beginning from coracoid process, and this muscle is coming and getting inserted onto the humerus, shaft of humerus. And we all know where is humerus bone present. It is in the arm, and arm is also known as brachium. That is why brachialis. So what is the name of this muscle, guys? Coracobrachialis. Coracobrachialis. It is beginning from the coracoid process and inserting onto the humerus here, coracobrachialis. Lovely. Now what is the meaning of bi? Bi means two. Bi means two, and seps, the word is coming from cephalus. Cephalus means head. Biceps, 2 heads. 2 heads. So my dear friends, you can see the bicep muscle will be having 1 head again coming from here only, coracoid process only. This will be the short head. I can see 1 more tendon coming from here, and this one will be the long head of the biceps. So there is a short head of biceps and the long head of biceps, and these 2 heads will combine together, and they are going to form a common muscle belly. They're not like separate. They form a common muscle belly. And then observe this thing very carefully. Already image based question has been given in the MCA exam. The tendon of the biceps is going to cross elbow joint. ये elbow joint को cross करेगा. It is going to cross the elbow joint and enter into forearm. Now in the forearm, you all know that there are two bones, radius and ulna. It is going towards the radius side and it is going to get inserted onto the radial tuberosity. It's inserting onto the radial tuberosity. That's important. Already image based question has been given in your exams. आपके एग्जाम में ऑलरेडी ये इमेज बेस्ड क्वेश्चन दिया गया था. ठीक है जी. So please take care about that. Okay, radial tuberosity was already given in the MCA exam, and that was the, radial tuberosity was the part that was marked in. I hope you're comfortable with this one here. I'll repeat once more in the diagram here right now, guys. Look here. This one is the short head of biceps and this one is the long head of biceps. Short head and the long head, both of them will combine together to form a common muscle belly, and then it will go and get inserted out of the radial tuberosity. Done. Now cut this biceps muscle. अगर आप इसको कट करोगे, below the biceps muscle you are able to see this muscle here right now, guys. And this muscle here is brachialis muscle, and that muscle will be getting inserted onto the other side, that is ulnar tuberosity of ulna. Okay, so that's what I made you write down in order. Number one, you're going to learn about the coracobrachialis muscle. Number two, you're going to learn biceps brachii muscle, and number three, you're going to learn brachialis muscle. So let us repeat the names again, guys. Coracobrachialis, biceps brachii, brachialis muscle. This is the conceptual way of learning. Okay. Another thing I'll tell you, some of the students will try to learn with mnemonic, that is BBC. What are the muscles present in the anterior compartment of the arm? That is nothing but BBC. That is your brachialis, biceps brachii and coracobrachialis types. So when is asking brachialis is originating from where, you can clearly see in the diagram here, brachialis muscle is originating from the shaft of humerus bone. And my dear friends, if you learn in this manner, one major nerve completed. Done. हो गया sir. Musculocutaneous nerve, origin, root value, the compartment, and the muscles in the compartment, the anterior compartment of arm. Done. हो गया. Are you okay with that? Now do one thing here. Once you're done with this one, let us discuss the MCQs related here, sir. Add a note there. Note करके लिखो sir. In the note, write down there note number 1. Guys, out of these three muscles, one of the muscle will be pierced by musculocutaneous nerve. Can anyone tell me which muscle will be pierced by musculocutaneous nerve? Absolutely correct. It is coracobrachialis. And now people will write down this, sir. Coracobrachialis muscle is pierced by musculocutaneous nerve. MCQ number 1. Out of these three muscles, one of the muscle that is pierced will be coracobrachialis. Coracobrachialis muscle will be pierced by musculocutaneous nerve. Next. Now once you're done with this one, guys, point number 2. Out of these three muscles, muscle number 3 that we have written there, brachialis muscle, you have to divide the brachialis muscle into like two halves. The medial half and the lateral half. And out of this medial half and the lateral half, remember, the medial half of the brachialis will be only supplied by musculocutaneous nerve. Whereas the lateral half of the brachialis muscle will be supplied by radial nerve. Just you write down, I'll explain you this one, guys. I hope you're done. Now, my dear friends, observe here right now. Look at this diagram again. In this diagram, this is nothing but the anterior compartment of arm. Okay, ठीक है. And now my students are expert. All the muscles should be supplied by which nerve? Musculocutaneous. But there is an exception. So please be alert right now, guys. Musculocutaneous nerve will be supplying to coracobrachialis muscle completely, entire muscle. Musculocutaneous nerve will be supplying to biceps brachia muscle completely, entire muscle, completely supply करेगा. But when it comes to brachialis muscle, remember brachialis muscle divide that into like two halves, and remember that only the medial half on the medial side, this one sir, only the medial half, only that medial half will be supplied by musculocutaneous nerve. Then what about the lateral half sir? Lateral half कौन supply करेगा, कौन supply करेगा? So now my dear friends, look here. You all have at least studied once in your life. If this is your arm, inside the arm which bone do you have, guys? Humerus bone. Come on, which bone do you have? Humerus. I think each and every medical student knows that the shaft of humerus, behind the shaft of humerus के पीछे, humerus के पीछे, there will be a spiral groove here. And inside that spiral groove, which nerve is going to pass? Radial nerve. You know that radial nerve will take a turn here like the spiral. Radial nerve will spiral here right now. Come on, do you know that? Humerus bone and humerus bone ke piche, radial nerve will take a turn. And that radial nerve is going to take a turn here and come on this side. And after coming on this side here, the radial nerve is going to supply to which half? The lateral half. Acha. So, radial nerve is going to come from behind here and it is going to supply to which half here right now, guys? That is the lateral half. Oh my God. So, that's extremely important. So I'll repeat once more here right now for the last and final time. All the muscles in anterior compartment of arm will be supplied by musculocutaneous nerve. But exception, coracobrachialis completely supplied. Biceps brachii completely supplied. But when it comes to brachialis muscle, divided into two half, medial half and the lateral half. Medial half is supplied by musculocutaneous nerve, whereas the lateral half will be supplied by which nerve? Radial nerve. Is it okay? That's what we have written here. Note number 3. Can anyone tell me what is the definition of composite muscle? Composite muscle or hybrid muscle कहते हैं. What is the meaning of composite muscle or hybrid muscle? Yes, lovely, absolutely correct, absolutely correct. Write down the definition that muscle supplied by two nerves. A muscle should be supplied by two nerves. There should be like one muscle supplied by two nerves. Easy English, easy to understand. It is nothing difficult definition. It's very easy. There should be one muscle and it should be supplied by two nerves. Sir, but why are you teaching this right now, here, right now? Can anyone give me an example of a composite muscle? Example of a composite muscle. A composite muscle example here will be the brachialis muscle, guys. Okay, brachialis muscle. Lovely. So it is like one muscle which is the reason why I'm making you write down this one here itself. So finish off here itself. But Suno, hello, please be very, very careful here. Don't think that brachial our entire body which is composite. There are many composite muscles in our body. Many composite muscles in our body. Is it okay? And you have to make a list of that. I'm done with the conceptual part. So what is the meaning of composite muscle? Muscle supplied by two nerves. Okay, so keep on making the list of that. चलिए अब हम बढ़ते हैं आगे. Let's go ahead right now, guys. Now, my dear friends, note number 4. Have you ever thought कि why is musculocutaneous nerve known as musculocutaneous nerve? Come on. Musculocutaneous nerve को musculocutaneous क्यों कहा जाता है? It will be supplied to the muscle, and cutaneous means it will be supplied to the skin. Musculocutaneous. Lovely. Today I made you all perfect in the muscles. Musculocutaneous nerve is supplied to which muscles? I told you, I taught you. Can you people help me? Okay, it will be supplied to which skin? Skin. Kaha? Where? Come on, lovely. I'm really happy that you people are involved in the discussion. चलो यहाँ देखो सर. Try to remember like this from today onwards. Everyone here. Everyone here. Look at my forearm here right now, guys. Musculocutaneous nerve is supplied to the muscles in arm. Musculocutaneous nerve is going to supply to the muscles in arm. And after supply to the muscles in arm, it is not going to stop here. That will continue. And that is going to supply to the skin on the lateral side of the forearm. Oh my god. Musculocutaneous. Musculocutaneous. Muscles in the arm, whereas skin in the forearm on the lateral side. So please write down there. Musculocutaneous nerve supplies, or you write down there, continues. Musculocutaneous nerve continues as lateral cutaneous nerve of forearm. That's important. It will be supplied to the muscles in arm, but skin in the forearm. Take care about that. And after this, my dear friends, please mark a line here. Now we are done with the first major nerve. पहला major nerve complete हो चुका है. Assuming that you people are like fresh right now, guys. So please learn this like properly right now. This is like the important part. Many questions are coming from here. So I don't want you people to get distracted right now. Another 40-45 minutes completely with me. Forget about everything in your life. सब कुछ भूल जाओ जिंदगी में, मेरे साथ में रहो. So totally how many major nerves? 5. And out of that 5 major nerves, first one, that is your musculocutaneous nerve. Done. Okay. Not only that, we are even done with the possible MCQs here. Now the next nerve that we are going to learn, right on the heading there as the axillary nerves. Axillary nerve. Come on. पहले ना आपकी बारी. First your turn. You people actually teach me whatever you know, and whatever you don't know, I'll teach you guys. Okay? तो लिखते जाओ. Axillary nerve. First of all, origin. Origin आप सबको पता है. Just now we have revised in the beginning of the class. Axillary nerve is going to originate from the posterior cord of brachial plexus. Posterior cord of the brachial plexus, and there the mnemonic is lunar, and we are actually discussing about axillary nerve. Lovely. In the bracket, write down the root value. Root value is only C5 and C6. I taught you yesterday. And after writing the origin, what is the next thing to write down? Hamesha sir, always make a protocol. After writing origin, write down there supply. It supplies to which muscle? And we know that it will be supplying to only and only two muscles. Number one, that is the deltoid muscle. Another one will be the teres minor or major. Teres minor muscle. Lovely. Oh my god. Look at the beauty of learning conceptually here. I'm done with the axillary nerve. मुझे कुछ नहीं पढ़ना है. Hello my dear doctors. Axillary nerve खलास हो गया है ना. कितना easy है ना. So that's the thing, guys. In our MBBS days, they'll be teaching us in a very very complicated manner. It is such an easy thing. Learn in a proper conceptual manner. तो रूट वैल्यू आपको ऑलरेडी पता है, ऑरिजिन आपको ऑलरेडी पता है, एंड मसल्स आल्सो यू ऑलरेडी नो. आई डोंट हैव टू टीच यू एनीथिंग. एक्सिलरी नर्व हो गया सर. ठीक है. अच्छा एक काम करो यहाँ पर ना, जस्ट ऐड वन मोर थिंग हियर राइट नाउ. ओके, रिसेंटली इन योर एमसीए एग्जाम दैट हैज बीन आस्क्ड, जस्ट ऐड देयर. यार सप्लाई टू द मसल्स विल बी मोटर और सेंसरी? सप्लाई टू द मसल्स विल बी मोटर, है ना. And now apart from the muscles, axillary nerve will be also supplied to the skin also. But it is supplied to which skin? And now please stop writing and look at me here. You have to look at me here. Okay? Everyone please look at me here right now. Now axillary nerve is actually going and supplying to the deltoid muscle. Okay? Axillary nerve is supplying to what's the deltoid muscle? Not only deltoid muscle, it is supplying to the skin covering deltoid. The skin covering deltoid. Okay. But sir, how to describe this one? How to describe the skin covering deltoid? Suppose you and me, if you are sitting straight here right now, अगर हम ऐसे straight बैठेंगे तो where is our deltoid muscle? Okay. डेल्टॉइड मसल कहाँ पर होता है? अगर हम लोग ऐसे स्ट्रेट बैठेंगे डेल्टॉइड मसल कहाँ पर है? ऑन द लेटरल साइड है ना, डेल्टॉइड मसल ऑन द लेटरल साइड. तो स्किन कवरिंग द डेल्टॉइड मसल, skin covering the deltoid muscle will be on the lateral side of arm. Okay, done. I repeat again, skin covering the deltoid will be on the lateral side of the arm. Done. Acha, not only that, is it on the complete lateral side of the arm? No, only on the upper lateral side of the arm. Which one? Upper lateral side of the arm. Understanding here? So if someone touching you here, you are able to sense by which nerve? Axillary nerve. Understanding? So I repeat once more here right now. Axillary nerve is supplying to which muscle? Deltoid. Not only muscle, it is also supplying to skin covering deltoid. How to describe that? Upper lateral side of the arm. Upper lateral side of the arm. Okay. So please write down here sensory supply. Sensory supply. Okay. And write down axillary nerve will be supplying to upper lateral side of arm. The skin covering the deltoid is nothing but upper lateral side of the arm. Done, done, done. So, हो गया. Now we are actually done with the axillary nerve. Axillary nerve completed, done. अब हम क्या करेंगे? Now what we are going to do is we are going to discuss all the concepts related to axillary nerve. Axillary nerve से related whatever concepts are there, we are going to learn. Okay, and in that first let us learn about the deltoid muscle. I'll come to that so well. Don't worry about that. तो axillary nerve से related जितने भी concepts है अभी हम पढ़ेंगे, and in that first we are going to learn about what guys? Deltoid muscle. So please write down the heading here as deltoid muscle. Now everyone of you knows that whenever you learn about any muscle in anatomy, first learn origin, then insertion, and then the nerve supply, and then action. So deltoid muscle or any muscle in anatomy, if you're learning any muscle in anatomy, first you got to learn the origin, then insertion, then the nerve supply and the action. Okay? Now everyone look at this picture here. This bone is actually our scapula, the bone present behind scapula. Okay. But you know, the scapula bone is actually a flat bone. A flat bone will have anterior surface and a posterior surface. And now suppose if I am giving you a real scapula bone in your hand, how are you going to differentiate the anterior surface and the posterior surface? आप कैसे पहचानोगे? अगर मान लो कि if I am giving you a real scapula bone in your hand, then how are you going to differentiate the anterior surface and the posterior surface? With the help of the spine. And where do you have the spine? The spine is present behind. Acha. If this is scapula, anterior, posterior, posteriorly will be having spine. Look at the diagram here. So this will be the anterior surface of the scapula. This is the anterior surface of the scapula. And this will be the posterior surface of the scapula. And on the posterior surface of the scapula, you have got the spine of the scapula here. So this is the spine here right now. And the spine will continue here into the acromion process. Is it okay? So it means that you even try to apply this diagram on your body. It means the spine kahan par hota hai? Piche. And that will continue into the acromion process on the lateral side. So spine is present behind posteriorly, and that will continue to acromion process, and acromion process present laterally. And the important thing to understand here is that the acromion process will come here anteriorly and it will form a joint with the bone present here. And what is the bone present here? Collarbone, clavicle. So it is going to form acromioclavicular joint. Acromioclavicular joint. Are you okay with this one here? So posteriorly will be having spine. Posteriorly will be having spine. Laterally acromion process and anteriorly clavicle. So as a doctor, you should have this complete U shape in your mind. a complete U shape in your mind. Now, why am I telling you about this one here right now? Why? Because your deltoid muscle is actually a multipinnate muscle. It is having fibers coming from different direction. Anterior fibers, posterior fibers and lateral fibers. How many fibers are there? Anterior fiber, posterior fiber and lateral fiber. And my dear friends, अब इन दोनों कहानी को जोड़ दो. Come on, you only tell it, guys. Anterior fibers are going to originate from where? Anterior fibers of deltoid are going to originate from where? Come on. Clavicle. From the clavicle. Posterior fibers are going to originate from where? The spine of the scapula. And lateral fibers are going to originate from the acromion process. Come on. Everyone please look at this diagram here right now. In this diagram, this is the spine of the scapula. That will continue into acromion process and that will continue here and get attached to the clavicle. From the clavicle, anterior fibers, and from the spine, posterior fibers, and from the acromion fibers, lateral fibers. Is it okay? Let me tell you like more clearly right now. These are the anterior fibers of the deltoid originating from the clavicle. Put a turn. Now, if these are the anterior fibers, then this will be the lateral fibers of deltoid that is coming from acromion process. And let us turn this behind. पीछे turn करते हैं. Now, in this diagram, you are able to see the posterior fibers coming from the spine. So these are the anterior fibers coming from clavicle. These are the lateral fibers coming from acromion process, and the posterior fibers coming from the spine of the scapula. And all these three fibers will converge here, and they will converge at, or they will get inserted at, a tuberosity here. There will be a U-shaped tuberosity, and the name of that itself is deltoid tuberosity. And where do you have the deltoid tuberosity? On the humerus bone here. Is it okay? So please welcome back to the notes now. Deltoid muscle has got anterior fibers. Number 2, it has got the lateral fibers. And number 3, it has got the posterior fibers. Anterior fibers, lateral fibers and the posterior fibers. The anterior fibers of the deltoid are originating from clavicle. Lateral fibers will originate from acromion process. And the posterior fibers are going to originate and all these fibers, all these three fibers are going to combine together and they are going to get inserted. They are going to be inserted onto the deltoid tuberosity of humerus. Onto the deltoid tuberosity of humerus. And what is the nerve supply? Nerve supply, my students are like expert in the nerve supply. What is the nerve supply to deltoid muscle? Yes, it's axillary nerve. क्या बात है? Axillary nerve. Origin हो गया, insertion हो गया, nerve supply हो गया. And now welcome to the action right now, guys. And action again the same thing, same like yesterday. Let us learn first practically. Okay. Action of the deltoid muscle. Let us learn practically. It is not that easy, iPhone. It is not like adduction, abduction. Yeah, देखो. Now, everyone, 1 second, please stop writing and look here. Everyone, look here. Anterior fibers of deltoid, when they contract. Anterior fibers of deltoid, when they contract, my arm will move like this. And this is known as flexion of the arm. And when the posterior fibers of deltoid will contract, my arm will move like this. And that is known as extension of the arm. So flexion of the arm and then extension of the arm. Understanding here? So I repeat again, anterior fibers of deltoid when they contract, you can also apply practically in your, don't try to just simply mug up, guys. I am against mugging business. I am against doing ratta. So So don't do any rata, no working business. Practically apply on your own body. If anterior fibers will contract, flexion, and if the posterior fibers will contract, extension. Acha, not only that, the anterior fibers will help in flexion as well as medial rotation, and the posterior fibers will help in extension as well as lateral rotation. Understanding? Now the last and final thing here is that what about the lateral fibers? Chalo, you apply right now. When these lateral fibers will contract, जब ये contract होंगे, what is going to happen? It is helping in moving the arm like this here, lifting the arm, and that moving away is known as abduction. B, abduction. Moving towards the body, adduction. Moving away is nothing but abduction. Okay, it makes sense now. So please write down there. Anterior fibers will help in flexion and medial rotation. Flexion and medial rotation of arm. The posterior fibers will help in extension and lateral rotation. Extension and lateral rotation of the arm. And once these two are done, the lateral fibers will be actually helping in abduction of arm. Deltoid muscle, done. Okay, so we are done with the origin, we are done with the insertion, and then we are done with the, the action, everything is done. Okay, are you done? Are you all done? Now, once you are done with this, entire deltoid muscle here right now, why am I teaching you this one here right now? Is there any important question that has been asked in MC exam? Yes, many a times. Come on guys. Ab aati hai bari, the most important thing. What is the action done by lateral fibers of deltoid? Lateral fibers of deltoid are helping in abduction. They are helping in abduction of the arm. I request every one of you to please stop writing and look here. Look at me. Everyone please stop writing and look at me here. Actually now, if I am doing the abduction of arm right now guys, I am moving the arm away. I can keep on moving the arm like this from 0 degrees to 90 degrees. Okay. Not only 90 degrees, I can even move the arm up here right now up to 180 degrees. Are you getting me? So we can keep on doing the abduction of the arm. Moving away is abduction. So from 0 degrees up to 90 degrees, and from 90 degrees above up to 180 degrees, I can do the abduction. Okay, we can keep on doing the abduction of the arm. Fine. Now, the question in the MCI exam was, will deltoid muscle help in initiating the abduction of the arm? Will it initiate the abduction of the arm? क्या ये abduction of arm start करेगा from 0 degrees? No, it will not initiate the abduction of the arm. Sir, how can you tell that? How can I tell that? Why? Because it is very, very clearly given in Gray's Anatomy that it is going to do the abduction of arm from 15 degrees to 90 degrees. Oh. इसीलिए तो मैं आपको ना ये सारा कॉन्सेप्ट पढ़ा रहा हूँ. आई एम टीचिंग यू दिस एंटायर कॉन्सेप्ट फॉर दिस थिंग ओनली. 15 से 90 डिग्री, 15 to 90 degree, 90 degrees. So from 15 degrees to 90 degrees, our arm is lifted, abducted by deltoid muscle, and this has been asked in your exams. Take care about that. Understanding? So, my dear friends, automatically the question is coming in our mind right now. Then which muscle is going to do from 0 to 15, 15 to 90, and then above 90 degrees, guys? So now from here itself, let us continue into the next concept. Heading likho sir, abduction of arm. Abduction of arm. 0 to 15 degrees, 15 degrees to 90 degrees, and then above 90 degrees. One of the most important and hot favorite of your MC examiners. Hot favorite concept sir, abduction of arm. कई बार पूछा है, not only in the MC exam sir, even in AIMS exam, even in NEET exam, many a times this abduction of arm has been asked. 0 to 15 degrees, 15 to 90 degrees, and above 90 degrees. Is it okay? Now look here. First, I'll do the same thing. First of all, we'll do it practically here right now, and then afterwards we'll write on the notes. Stop writing and look here. So follow my instructions very quickly. First follow here. Okay. See, अभी मैंने आपको पढ़ाया था. What is this bone present behind the scapula? Scapula will be a flat bone. Anterior surface, posterior surface, spine. And now because of that spine, one muscle is like above the spine and one muscle is like below the spine. One muscle is above the spine, one muscle is below the spine. Supraspinatus muscle, infraspinatus muscle. Lovely. इतना प्यारा सा नाम है. It's a so simple name. Supra, above, spinatus, spine. Supraspinatus muscle, infraspinatus muscle. Now why I'm telling you about this one right now? Everyone now, please look at me here right now. Look at me. Spine के ऊपर, supraspinatus muscle here. And that supraspinatus muscle is going to contract. If that muscle will contract, what is going to happen? Our arm is going to move 0 to 15. Acha, 0 degrees to 15 degrees. 0 to 15 degrees. Which muscle? Supraspinatus. After that, the next responsibility is taken by lateral fibers of deltoid. They will now contract and bring the arm from 15 to 90. Beautiful. Understanding here? So supraspinatus muscle, I repeat again, will contract 0 to 15. And then lateral fibers of deltoid will contract 15 to 90. And now from 90 degrees I have to move my upper limb above, and that is not possible with by this small muscle. It requires a big muscle, that is your trapezius muscle behind, along with serratus anterior above 90 degrees. Is it okay? So keep on writing. 0 to 15 degrees is done by supraspinatus muscle. 15 to 90 degrees is done by deltoid muscle, and my students knows in depth it is done by lateral fibers of deltoid. Above 90 degrees is done by trapezius muscle. Not only trapezius muscle, along with serratus anterior muscle. So these two muscles will help in above 90 degrees abduction. So 0 to 15 degrees supraspinatus, 15 to 90 degrees will be done by deltoid muscle. Above 90 degrees will be done by trapezius along with serratus anterior. Wow, done. In one of the exams they have asked overhead abduction is done by overhead abduction. Remember, above 90 degrees itself is known as the overhead abduction. Above 90 degrees itself is known as the overhead abduction of the arm, and that is done by trapezius and serratus anterior. So we are done with the deltoid muscle followed by abduction of arm. This concept is done here. Okay, so be ready guys for this type of questions. Now the next concept. Can anyone tell me like how many nerves are related to the humerus bone? Next concept. Nerves related to humerus. Nerves related to humerus. Absolutely correct. There are totally 3 nerves which are directly related to humerus bone, and number 1 nerve will be the axillary nerve, and number 2 nerve here will be the radial nerve, and number 3 nerve here will be the ulnar nerve. So there are totally 3 nerves which are related directly to humerus. Another extremely important concept. Every now and then asked in the in your MC exam, guys. So what are the nerves which are related to humerus bone? Humerus bone is related to like 3 nerves: axillary nerve, radial nerve, and the ulnar nerve. And now we are going to learn kaise, kahan, how, and everything. And to learn these 3 nerves, how they are related to humerus, we need to draw the diagram of humerus bone here right now. Can anyone of you tell me upper end of the humerus? आपको पता ही होगा. Upper end of the humerus will have head of the humerus. Head of the humerus will be towards which side? Sochiye, think. Head of the humerus will be towards the which side? Obviously towards the medial side. Head of the humerus. Why? Because head of the humerus is the one which is forming shoulder joint, so it should be medial side. Done. Whereas there are two tubercles, greater tubercle, lesser tubercle. Remember, greater tubercle will be towards the lateral side and lesser tubercle will be present anteriorly. Now, some of the innocent students sitting along with us here, first year, second year, they'll get confused. Sir, क्या कह रहे हो? Lateral, anterior, medial. यहाँ देखो. In this diagram here, this is the head of the humerus and that will be towards the medial side. And this is the greater tubercle and that will be towards the lateral side. And this will be the lesser tubercle and lesser tubercle is present in the front, anteriorly, samne, mundu, it's in the front. And now, actually known as intertubercular sulcus. Beautiful, meaningful name. Inter in between, tubercular tubercles, and there is a depression in the middle, and depression is known as sulcus. Intertubercular sulcus. So, therefore, my dear friends, yes, this will be the head of the humerus here, and this will be the greater tubercle, and this will be the lesser tubercle, and in the middle you'll be having the intertubercular sulcus. Okay, that is the details about upper end. And lower end we don't have to worry. There will be a lateral epicondyle and there will be a medial epicondyle. है ना? तो चलिए, let us draw a big, neat and clear diagram of the humerus bone. Start drawing the diagram with me. Head of the humerus, greater tubercle, okay. So this will be the head of the humerus here, medial side, greater tubercle towards the lateral side, and in the front here, samne, you'll be having lesser tubercle. Okay? And in between the two tubercles, you'll be having a depression here, and this depression is said to be the intertubercular sulcus. Achha, one more thing. Intertubercular sulcus is also known as bicipital groove. Intertubercular sulcus is also known as bicipital groove. Why? What is the reason? Just now in the very beginning of the class today, I told you that long head of the biceps tendon is passing from there. Long head of biceps tendon is passing from here only. I have shown you that. If you are not able to recall, I think I'm having the diagram here itself. Yeah, you can see this diagram here right now, guys. This is the greater tubercle and this one is the lesser tubercle, and in between that, yes, you are able to see the long head of biceps. Bicipital groove. Biceps tendon, bicipital groove. Head, greater tubercle, lesser tubercle, intertubercular sulcus. If you are all comfortable with these three things, now two necks, anatomical neck and surgical neck. This neck here is known as the anatomical neck. Sir, how to identify anatomical neck? Anatomical neck will be between head on one side and the tubercles on the other sides. Anatomical neck कहाँ होता है? There will be a head on one side and the tubercles on the other side. इन दोनों के दरमियान में, in between the head and the tubercles, you'll be having anatomical neck. And there'll be one more neck here, and this neck is said to be the surgical neck. Okay. Answer: how to identify surgical neck? Surgical neck will be between the complete upper end of the humerus and shaft of humerus. Complete upper end and shaft, sir. So this is the complete upper end of the humerus and this is the shaft of the humerus. Complete upper end of the humerus and shaft of the humerus. So these many things you have to know about the humerus at least. So in this itself I am completing the bone also. Humerus bone bhi ho gaya is. ठीक है। now everyone observe here right now guys, सब लोग यहाँ पर देखिए। तो the head of the humerus, let me just repeat it once more here, the head of the humerus will be towards medial side, towards the medial side. The greater tubercle is towards the lateral side. Lesser tubercle is present anteriorly. In between the two tubercles, you'll be having a depression here, intertubercular sulcus, or also known as bicipital groove. Then there will be two necks, anatomical neck here between head and tubercles, surgical neck here between the upper end and the shaft. And once you have learned all these things, don't think that there are so many things to be learned, guys. Chill, relax. This is all like background story. What is our main concept? हमने heading क्या लिखा था? Nerves related to humerus. How many nerves are related to humerus? 3 nerves. And remember, out of the 3 nerves, the first nerve I made you write down axillary nerve. So चलिए लिखिए sir. Axillary nerve is the one which is passing behind the surgical neck of humerus. Axillary nerve passes behind the surgical neck of humerus. Axillary nerve passes behind the surgical neck of humerus. So my students, finally for your MCA exam, now you people now don't think that यार कितना कुछ पढ़ना है, like there is a lot to learn here. कुछ नहीं पढ़ना है यार, सिर्फ 2 point. Name of the nerve, location of the nerve. What is the name of the nerve? Axillary nerve. What is the location of that one? Surgical neck. Behind the surgical neck. The axillary nerve behind the surgical neck. हो गया. Number 2, I think I don't even have to tell you. There is a nerve which is going to pass behind the shaft, and this nerve will be the radial nerve. And radial nerve is actually passing from where only? It is actually passing from the groove. Which groove? The spiral groove. That spiral groove, in some books it is also known as radial groove, and you have to remember both of them. Radial nerve is passing in a groove there, and that groove is known as the spiral groove or the radial groove. And now the last and final one, I told you that there is a nerve which is passing behind the medial epicondyle. And the nerve which is going to pass behind the medial epicondyle, and that nerve will be the ulnar nerve. And this was like recently asked in MCA exam. Recently. Nerve passing behind the medial epicondyle. Actually ना, अगर मैं आपको सही बताऊँ तो अगर आप ना ये nerve को आप feel भी कर सकते हो. You can even feel this nerve. Okay. Just what you do is flex your elbow like this. This is elbow, and this one is medial epicondyle. यहाँ पर ये elbow है, ठीक है ना? And this one is medial epicondyle. And just behind the medial epicondyle के पीछे, just ऐसा ना finger रखो यहाँ पर and try to feel that nerve. There is a nerve there. If you feel there is a cord-like structure, and that is nothing but your ulnar nerve. अगर आप उसको ज़्यादा compress करोगे, there will be some tingling sensations. Don't do that, okay? So there is a ulnar nerve which is passing behind the medial epicondyle. So ulnar nerve is passing behind the medial epicondyle. Perfect. So finally, what you have to remember, guys? Yes, humerus bone is actually related to how many nerves? 3 nerves. That is the axillary nerve, radial nerve, and the ulnar nerve. Axillary nerve is actually passing behind the surgical neck of the humerus. Radial nerve is actually passing in the spiral groove, and the ulnar nerve is actually passing behind the medial epicondyle. Done. And you can go back and check in your previous year questions of FMG. Ulnar nerve has already been asked and radial nerve already been answered. One of the most important concepts to be learned. Hope it is done. Now here, because it is like very much important, musculocutaneous nerve is not related to humerus. See, please look at the heading. We are telling which nerves are directly related to this bone, and musculocutaneous nerve is actually passing in between the 2 muscles. Okay, नीचे आपका होता है brachialis और ऊपर होता है biceps. इन दोनों के बीच में से जा रहा है. तो musculocutaneous nerve is not related directly to bone. Bone से related नहीं है. Bone से related only these 3. Okay, Jay. Now because this concept is like very much important here right now, guys. Now let me include like 2 more points here right now. There is one artery which is passing along with the axillary nerve. Can anyone tell me what is the name of the artery? There's an artery passing along with the axillary nerve. Hello, my dear friends. Come on, tell me. Which artery is going to pass along with the axillary nerve? यहाँ पर देखो sir. See what happens here is that I'll tell you the method to remember this one. Don't simply mug up. I'll tell you the method. Here यहाँ पर होता है surgical neck of humerus. I'm having surgical neck of humerus. ठीक है okay control okay. Now I'm having surgical neck of humerus. And now if this is surgical neck of humerus here, अगर मान लो कि surgical neck of humerus है यहाँ पर round वाला, there is one artery going in the front here and there is one artery which is going behind here. Surgical neck of humerus, one artery going in the front and going behind. आराम से learn the basics properly. That's a problem. In our MBBS days, only rata, only mug up, no mug up. Learn basics. If the artery is going around, what is the name of the artery? Circumflex artery. In your anatomy, any time if the artery is going around, what is the name of the artery? Circumflex artery. Okay. And if it is going around the humerus, what is the complete name? Circumflex humeral artery. Circumflex humeral artery. Now my dear friends, circumflex humeral artery, I told you there are two of them, एक आगे और एक पीछे, anterior and posterior. Now tell the complete name, anterior circumflex humeral artery. And what is the complete name? Posterior circumflex humeral artery. Now out of these two, tell me which is going along with the axillary nerve, anterior wala ki posterior wala? Obviously, without any doubt, it will be posterior wala. Why? Because from that time we have been learning axillary nerve is passing from where? Behind surgical neck, posterior, पीछे से. So definitely, what is the artery along with that one? Posterior circumflex humeral artery. Axillary nerve along with posterior circumflex humeral arteries passing. Done हो गया. Now last and final point, there is one artery going along with the radial nerve here, sir. Oh my God, what is the name of this artery now? Last and final point. What is the artery going along with the humerus bone here? No, sorry, along with the radial nerve, sir, behind the humerus. Now my dear friends, I'll tell you one easy technique to remember this one. This is my arm. Arm is also known as brachium. That is the reason why, what is the artery in the arm here right now? Brachial artery. What is the artery? Brachial artery. And that brachial artery will give one branch, and that branch will go deep inside, and it is going along with the radial nerve behind, spiral groove. Okay? So brachial artery is giving a branch, and that branch is going deep. In anatomy, the word deep means profunda. Profunda means deep. And what is the name of the artery? Profunda brachii artery. So along with the radial nerve, which artery do you have, guys? You will be having profunda brachii artery. So along with the radial nerve, you will be having profunda brachii artery. Okay, and that is the reason why this one diagram is extremely important for you. Like many questions are possible from here. Axillary nerve along with the posterior circumflex humeral artery, radial nerve along with the profunda brachii artery. Done, sir. I'll give you 1 minute of time. Please revise all these things. Like many things are done. एक बार ना revision करो यहाँ तक revision करो, and then I'll tell you next concept. And don't forget, what are we learning, guys? What are we learning? We are learning the major nerves. How many major nerves do you have? 5. And out of the 5 major nerves, we are learning which one? The second one. Which is the second one? Axillary. We are dealing with the axillary nerve right. Okay. So चलो सर जल्दी से revise कीजिए. Revise quickly. What is the sensory supply of axillary called? Axillary nerve is supplying to upper lateral skin of arm. Prajwal, axillary nerve is supplying to upper lateral part of the skin of the arm. The L on the anterior side is lesser tubercle. G for greater tubercle, L for lesser tubercle. All the fibers of deltoid will be in all fiber, anterior, posterior, lateral, everything is inserted on deltoid tuberosity. Ajay, already I told you the axillary nerve supply. Ulnar nerve is also going behind medial epicondyle. Chalo sir. Now, once you're done with the revision till here right now, guys, the next thing that will go ahead. So, as I told you the concept here, we are actually having the 5 major nerves, and out of the 5 major nerves, we are dealing with all the major nerves one by one. We have completed only one major nerve till now, musculocutaneous, and now we are dealing with axillary right nerves. Okay, axillary nerve we are learning right now. Okay, तो चलिए अब हम बढ़ते हैं आगे. And now, my dear friends, don't think that in anatomy, sir, why are we teaching this one कि nerves related to humerus? हमको क्यों पढ़ना है ना? Why they are asking this one in the MCA exam? है ना? There should be some importance, right? Now, don't even think for a second in your mind as a doctor कि यार ये क्यों पढ़ना है हमको, कि कौन सी nerve कहाँ से जा रही है, ये इससे क्या यूज होगा. Tomorrow, a patient will come to you with a fracture of humerus. A male aged about 25 years riding on a bike meets with an accident होते ही humerus fracture, and he is into your hospital. The moment there is accident case with a fracture of humerus, you will take an X-ray. What is the most common site of fracture of humerus? Come on, let us correlate anatomy with orthopedics. What is the most common site of fracture of humerus? That is cervical neck. The moment you take an X-ray and you find the cervical neck of the humerus is fractured, अगर सर्जिकल नेक फ्रैक्चर होगा, इमीडिएटली फ्रॉम माय एनाटॉमी क्लास यू कैन रिकॉल, अच्छा सर ने कहा था विच नर्व इज गोइंग नियर सर्जिकल नेक, विच नर्व इज गोइंग नियर द सर्जिकल नेक, इट इज एक्सिलरी नर्व, एंड देयर आर चांसेस ऑफ एक्सिलरी नर्व गेटिंग डैमेज्ड, एंड फ्रॉम देयर यू कैन अप्लाई योर नॉलेज एज अ डॉक्टर. इफ एक्सिलरी नर्व इज डैमेज, सर ने कहा था इट विल बी सप्लाइंग टू विच टू मसल, डेल्टॉइड एंड टेरिस माइनर. अच्छा, डेल्टॉइड एंड टेरिस माइनर विल बी पैरालाइज्ड. अच्छा, सर ने ये भी कहा था कि डेल्टॉइड विल बी हेल्पिंग इन फ्लेक्शन, एक्सटेंशन एंड एबडक्शन फ्रॉम 15 to 90. आस्क दैट पेशेंट इन फ्रंट ऑफ यू टू लिफ्ट हिज आर्म. उसको बोलो कि अपने आर्म को ऐसे लिफ्ट करें, एबडक्ट करें. ठीक है. द मोमेंट ही इज ट्राइंग टू लिफ्ट हिज आर्म, ही विल बी एबल टू लिफ्ट 0 to 15. 0 to 15 डिग्रीज तो लिफ्ट हो पाएगा बिकॉज ऑफ सुप्रास्पाइनेटस. इट इज वेरी गुड. नाउ 15 to 90 degrees he will not be able to lift. The moment he is going to lift up to 0 to 15, after that, डॉक्टर साहब ये लिफ्ट नहीं हो रहा है आगे, खलास खत्म. From there you can easily confirm. सर ने क्या कहा था, 15 to 90 deltoid. He is unable to do that. Deltoid gone. If deltoid is gone, which nerve is gone? Axillary nerve. Axillary nerve is gone. Where is the fracture? Pakka surgical neck of humerus. Are you getting the story right now? Hello everyone. So that's how you need to correlate. Understanding my point here right now, sir? तो थोड़ा सा फील हो रहा होगा आपको कि you are going to become like you will are becoming doctors right now, है ना? So this is how you have to correlate. So tomorrow, if a patient comes to you with a fracture of shaft of humerus, if shaft of humerus is fractured, which nerve might be damaged? Radial nerve, something like that. Okay. चलिए अब हम बढ़ते हैं आगे towards the next concept. Is it okay? Now please look at this diagram here right now, guys. A little bit more in depth right now. Okay. Look at this diagram here right now. First of all, the moment you look at this diagram, identify whether it is a front view or back view. Front view है या back view है? Yes, absolutely it is back view. अब आप एक काम करो sir, do one thing here right now. Don't write anything, don't do anything. Just look at the screen and try to identify everything. I'll tell you when to write. Okay? खाली बस देखते जाओ. लिखना ही नहीं है. No need to write on anything for 2-3 minutes. Look here. This is back view. Already we know that this is the spine of the scapula and this one is the acromion process. What is this muscle above the spine? Come on, answer me. Supraspinatus muscle. What is this muscle below the spine? What is this muscle below the spine? Infraspinatus muscle. And then lateral border of the scapula. This is lateral border of the scapula. Near the lateral border of the scapula, you'll be having two muscles here right now, guys. And teres major. And now, my dear friends, this muscle here will be the long head of triceps. Sir, how come this is triceps? You only told me okay, we are seeing the back view. अगर आप पीछे से देखोगे, what is this muscle here behind? This is long head of triceps, and this one will be humerus bone. Nothing to tell there. Now I want you all to concentrate on number 1 teres minor, number 2 teres major, number 3 long head of triceps, and number 4 this humerus bone here. Look at the way how it is arranged. Teres minor, teres major, long head of triceps and humerus. The way they are arranged, because of this arrangement, I am able to find one rectangle shaped space here, quadrangular space. Acha. I am able to find a triangle shaped space here, triangular space. And I am able to find one more triangle shaped space above here right now, one more triangular, upper triangular, lower triangular. So basically I am now teaching you the spaces, intermuscular spaces. Quadrangular space, upper triangular space and lower triangular space. And now my dear friends, do one thing, again the same thing, don't write, look at the screen and try to answer. First you are going to learn the boundaries. What is the space here right now? Quadrangular space. Quadrangular space. And quadrangular space here, superiorly teres minor, inferiorly teres major, medially long head of triceps, and laterally what you have, you'll be having your humerus bone. Lower triangular space, superiorly teres major, medially long head of triceps, and laterally you'll be having what, guys? Humerus again. Upper triangular space will be like, superiorly teres minor, inferiorly teres major, and laterally you'll be having which muscle here right now? That will be the long head of triceps. Are you getting me? So the first thing that you have to learn in all this will be the boundaries. Is it okay? अब आपको लग रहा होगा कि सर ये boundaries इतना difficult है. In every name you're having teres minor, teres major and all those. How to make it easy? Everyone look here. Come on. Take your two fingers like this. Come on, take your two fingers like this. This one above one is teres minor and this one is teres major below. ऊपर छोटा वाला teres minor and नीचे बड़ा वाला finger, your favorite finger, and this one is teres major. Teres minor, teres major. Okay. And after that, yes, take another two fingers, keep it vertical like this. This one is long head of triceps and this one is humerus. Long head of triceps and humerus. And now just overlap them like this. Essay. If you overlap them like this here, can you see a space form here? This one is quadrangular space. And below here, this one is lower triangular. And above here, this one is the upper triangular space. Are you getting me? And that's the best way to remember the boundaries right there. Is it okay? So, chalo sir. Now start writing the notes. Number 1, quadrangular space. Heading लिखो boundaries. ठीक है. Superiorly you'll be having teres minor. Inferiorly you'll be having teres major. Medially you'll be having which muscle? Long head of triceps. And finally laterally what you have here, you'll be having humerus. Exactly which part of the humerus? Surgical neck of humerus. Very careful. Surgical neck of humerus. Apart from this, what else they will ask you? They'll ask you what are the structures passing from this space. If there is a quadrangular space, from the quadrangular space, what are the structures passing? And my students, now you don't even have to mug up this one. I already gave you the hint. Come on, surgical neck. What is passing near the surgical neck? Bolo. The axilla, what is the art? Posterior circumflex humeral artery. क्या बात है यार. Such a difficult topic made easy. Easy. Boundaries are made easy with fingers. Okay, like this. And then the content of that one, what is passing from there, already made easy in the last topic itself. What is passing near the surgical neck of the humerus? Axillary nerve along with the posterior circumflex humeral artery. Perfect. That is the easiest way to remember this topic. इसीलिए ना मैं आपको ना बार बार कह रहा हूँ, प्लीज लर्न इन माई वे. Please learn all the topics in the same sequence. It will help you a lot. Removing this now. Now please write down the next heading there as the lower triangular space. Lower triangular space. Boundaries. Superiorly you will be having teres major. Medially you will be having long head of triceps. And then laterally what do you have? Humerus. But this time which part of the humerus? Shaft. You can clearly see lower triangular space here right now. तो lower triangular space यहाँ पर है, तो यहाँ पर क्या होगा guys? Here will be having the shaft of humerus. And now what are the structures passing? I made you write down the shaft of humerus. That is the hint. Chalo, bolo. What are the structures passing near the shaft of the humerus? Radial nerve. And along with the radial nerve, which artery? Deep one, profunda. Profunda brachii artery. Done. Lower triangular space हो गया. Now the last and final one, we'll see the upper triangular space and then wind up this one. Upper triangular space. Upper triangular space. Again the same thing, boundaries. What do you have superiorly? Teres minor. What do you have inferiorly? Teres major. And what do you have laterally? Laterally you'll be having long head of triceps. Okay. And now I request all of you to please stop writing here right now. I did not teach you about what is the structure passing from here. सब लोग यहाँ पर देखिए, look at the diagram. Above teres minor, below teres major, laterally you'll be having the long head of triceps. Guys, this is the upper triangular space here right now. Can you see that there is one artery coming there, taking a turn and coming out here? There is an artery taking a turn here right now. है ना? Now you all know that whenever any artery takes a turn, what is the name of the artery? Circumflex. In anatomy, any artery taking a turn, what is the name, sir? Circumflex. And it is taking a turn around what? Around scapula. So what is the name of that one? Circumflex scapular. What is the name of this artery? Circumflex scapular artery, and that is passing from here right out. So what is the structure passing? Circumflex scapular artery. The structure passing from there will be circumflex scapular artery. ठीक है? So this is how we can make the topics easier, guys. Come on, everyone, please look into your books. Actually, हम लोग ने कहाँ से start किया था? Second major nerve will be your axillary nerve. But along with the axillary nerve, guys, many topics are completed. Topic number 1, deltoid muscle, done. Topic number 2, abduction of arm, 0 to 15, 15 to 90, above 90, done. And then topic number 3, we are even done with the nerves related to humerus. And then topic number 4, we are done with all the spaces, quadrangular space, upper triangular and lower triangular space. Many topics are done related to axillary nerve. Now we'll finish this topic of axillary nerve by writing about the injury of the axillary nerve. अगर axillary nerve injure होगा तो क्या होगा? Injury of axillary nerve leads to what? Come on, write down. Number 1, I'll keep on writing here. You tell me true or false. Number 1, it will lead to atrophy of deltoid muscle. Injury to axillary nerve will lead to atrophy of deltoid muscle. Yes or no? Of course. Axillary nerve is supplying to deltoid. If deltoid is not working, then what will happen? That muscle will be atrophied. Absolutely true. Number 2, loss of rounded shape of shoulder. True or false? Absolutely true. ठीक है? Why? Because our shoulder right now is appearing beautifully round because of which muscle? Deltoid. अगर deltoid muscle ही atrophy हो जाएगा, it will lead to flat shoulder. Shoulder will be flattened. Loss of rounded shape of the shoulder. Number 3. Now tell me, it will also lead to weakness of abduction of arm above 15 degrees. True or false? Absolutely. 0 to 15 degrees is done by supraspinatus. No problem with the supraspinatus. But 15 to 90 degrees is done by, above 15 degrees is done by deltoid. Deltoid is gone. Axillary gone. That is why weakness of abduction above 15. 15 degrees के ऊपर आप abduction नहीं कर पाओगे अगर axillary nerve injure हो जाएगा तो. Now the last and final one, the fourth one, loss of sensation of upper lateral side of arm. Loss of sensation of the upper lateral side of the arm. Yes or no? Absolutely true. मैंने आपको क्या बताया था? What did I tell you? What did I tell you? I told you that axillary nerve will be supplying to which skin? It is supplying to the skin covering the deltoid. And where is that skin covering deltoid? Upper lateral side of the arm. And if axillary nerve is injured, then what will happen? You are not able to sense anything from upper lateral side here. Is actually known as the regimental badge sign. इसी को हम regimental badge sign कहते हैं. Regimental badge sign कहते हैं, ठीक है ना? Mayank, it will not be possible after 90. Why? Because after 15 itself you are unable to lift. But how can you lift after 90 then? It should be supported by deltoid up to 90 ना, तो उसके आगे possible नहीं होगा. ठीक है जी? So now loss of sensation in the upper lateral side is known as regimental bassin. See, I think you know this word regimental. It comes in, army people, that regimental badge and all. And army people will be wearing badges on the chest here. They'll be wearing badges on the shoulder. They'll be wearing badges here also. So in that area, you are unable to sense. That is why doctors kept the name as regimental badge sign. So that was asked in the exam. In regimental badge sign, what is the nerve involved, sir? The nerve involved is, what is the nerve involved in regimental badge sign? Axillary nerve will be injured in the regimental nerve. Okay, fine here right now. So that is about the applied aspect of the axillary nerve. Agar axillary nerve injure hoga, so this is what will happen, and that completes our second major nerve. Not only the second major nerve, axillary nerve, guys, we are even done with many concepts along with that itself done. So please follow my strategy here right now. We are having like 5 major nerves. Musculocutaneous nerve आप पहले पढ़ोगे, done. After that you are going to learn axillary nerve and done. And now you are going to learn ulnar, median and radial nerve. These 3 nerves together, and that is something extremely important. Why? Because now we are going to learn the partial claw hand, complete claw hand, wrist drop. Everything will come into play. Okay? So I'll give you like 2 minutes of time. In 2 minutes, first you revise these 2 nerves. Then we'll go to a higher concepts of ulnar, median and the radial nerves. Okay. Listen very carefully now. ठीक है. First, I'm going to teach you the ulnar nerve. सबसे पहले मैं आपको ना ulnar nerve पढ़ाऊंगा, and that is going to take a little bit of time. It will take some 15-20 minutes of time to study ulnar nerve. But once you are done with the ulnar nerve जैसे ही complete हो जाएगा आपका, the median nerve and the radial nerve will be done in 2 minutes. Done. Is it okay? So study ulnar nerve very carefully right now. Start writing the heading now. Heading लिखो. First of all, learn the another name of the ulnar nerve. It is also known as musician's nerve. Ulnar nerve is also known as musician's nerve. I'll tell you later on why. And in any nerve, what is the first thing to write down, guys? Origin. किसी भी nerve में सबसे पहले क्या लिखना चाहिए? Origin. And origin आप सबको already पता है. Ulnar nerve is going to originate from which cord? Medial cord of brachial plexus. What is the mnemonic for medial cord, guys? M4U. We have been learning since yesterday. And U stands for ulnar nerve. Chalo. Better. Origin we already know. What about the root value? The root value of the ulnar nerve will be C7, C8 and T1. The root value of the ulnar nerve will be C7, C8 and T1. That's an exception one. ये भी हमको already पता है. Now once you are done with that, the next thing after writing origin will be the supply. Ulnar nerve supplies to what? Ulnar nerve is going to supply to what? Yes. अब यहाँ से start होती है the real story, actual कहानी. So everyone get set ready now. In forearm and then in hand. Okay. And you people already know that. Ulnar nerve will be supplying to which muscles in arm? Remember, it will not be supplying to any muscles in arm. Sir, how can we say that? अब आप ना ये मत सोचो कि ना सर हमने कभी पढ़ा है क्या, कभी any time we have learned in life or not. No need to recall that one. Just recall my golden rule. I taught you yesterday and today also we have revised in the beginning of the class. I told you very clearly all the muscles in anterior compartment of the arm, musculocutaneous nerve, all the muscles in posterior compartment of the arm, radial nerve. So therefore ulnar nerve is not supplying to any muscles in arm. Easy, हो गया. Now after that the ulnar nerve will enter into forearm, of course. In forearm, ulnar nerve, will it supply to any muscles? Yes, it will supply. पहले सुनो आराम से. Okay, आराम से. In the forearm, ulnar nerve will be supplying to muscles in anterior compartment or posterior compartment? anterior compartment. In the anterior compartment, you already know that. In the anterior compartment, will it supply to all the muscles in the anterior compartment? No. How can you tell no? Why? Because sir ने हमको सिखाया था all the muscles in anterior compartment of the forearm will be supplied by two nerves, ulnar nerve and median nerve. So therefore, it is not supplying to all muscles. ये भी आपको already पता है. So you people already know that ulnar nerve will be supplied to the muscles in anterior compartment of forearm, and that too not all the muscles. आपको पता है. And now from here onwards I'll teach you. Come on, update your knowledge. In the anterior compartment of the forearm, ulnar nerve will be supplied to the medial 1.5 muscles. In the anterior what is the name of that? और हम क्या करेंगे in our class we are not going to mug up the names, we are going to make the name. चलिए हम लोग ना मिलकर उसका नाम बनाते हैं. तो look here how to make the name. Anterior compartment of the forearm, will you have flexor muscles or extensor muscles? You'll be having flexors. You'll be having flexors. ठीक है ना? Anterior compartment of the forearm, you'll be having what guys? Flexors. Flexors. And out of, because all these muscles are actually flexors, that is why इनका नाम क्या होगा? Flexor. And now there is one muscle here on the medial side, and from the medial side that muscle is going, getting inserted onto the carpal bone here. Okay, so therefore the name is flexor carpi. Flexor carpi. अच्छा, अगर ये muscle contract होगा तो it is going to pull the tendon and this is going to flex. Flexor carpi. And this muscle is towards the ulna or towards the radius. It is towards the ulna. That is why doctors kept the name as ulnaris. So what is the complete name of the muscle guys? Flexor carpi ulnaris. Okay na? So repeat that. Flexor carpi ulnaris. Repeat that. Flexor carpi ulnaris. Okay. But I told you very clearly, it is going to supply to how many muscles guys? 1.5. That means one more muscle. One more muscle is present here only. तो उसका नाम क्या होना चाहिए? Flexor. Its name should be flexor. And that muscle, its tendons are going into the digits, into your fingers, you know. And when the muscle is going to contract, your digits are going to flex. Flexor digitorum. And that is deep inside. And that is why the name will be flexor digitorum profundus muscle. What is the name of the muscle? Flexor digitorum profundus muscle. Guys, no disturbance at all. This is the dangerous part. अगर आपको ये समझ में आ गया, then you will enjoy the remaining topic. Okay ना? So please concentrate. So write down there guys, forearm, ulnar nerve will be supplying to medial 1.5 muscles of anterior compartment. In the forearm, ulnar nerve will be supplying to medial 1.5 muscles of anterior compartment. Now what is the name of the muscle? Number 1, flexor carpi ulnaris muscle, and number 2 muscle will be flexor digitorum profundus. Hope it is done. लेकिन यार यहाँ पर ध्यान दीजिए, मैंने क्या लिखाया था आपको स्टार्टिंग में? इट इज गोइंग टू सप्लाई टू, ulnar nerve is going to supply to 1.5 muscle. One complete muscle, flexor carpi ulnaris. It will be only supplying to the half of flexor digitorum profundus. Which half? Come on. Flexor digitorum profundus, ulnar nerve will be supplying to the medial half or the lateral half? Which half? Medial half or lateral half? It will be supplying to the medial half. Acha, apply common sense and tell me, if ulnar nerve is supplied to the medial half, then lateral half will be supplied by? Lateral half will be supplied by which nerve? Yes, that is a median nerve, guys. क्योंकि सर ने क्या कहा था? What is our golden rule? All the muscles in the anterior compartment are supplied by ulnar and median. अगर ulnar nerve supply नहीं कर रहा है तो obviously median nerve supply करेगा, and that completes about the forearm. So better you do one thing here, add a note below, sir. Note करके लिखो यहीं पर. Please add a note there. In that note, you write down there as FDP, flexor digitorum profundus muscle. And that muscle is divided into two halves, the medial half and the lateral half. The medial half will be supplied by ulnar nerve, and whereas the lateral half will be supplied by the median nerve. That is the reason why I think, yes, absolutely correct. This is like another example you can add to the list of composite muscle. Wow. Composite muscle or the hybrid muscle. Another composite muscle or hybrid muscle type. FDP, flexor digitorum profundus. Hope it is done. Now, now once it is done here right now, guys, तो आप देख रहे होंगे like in the sequence we are learning. चलिए एक बार रिवाइज करते हैं. Ulnar nerve will be not supplying to any muscles in arm. In arm, it is not supplying to any muscle. And in the forearm, it is supplying to the medial 1.5 muscle in the anterior compartment. One complete muscle will be flexor carpi ulnaris. Another one will be the medial half of flexor digitorum profundus. Done. हो गया. Now from here, the ulnar nerve will enter into the hand. And now let us see what are the muscles supplied by the ulnar nerve in the hand. Okay, so please continue below there. You write down below there after the note. Arm हो गया, forearm हो गया, and now please you write down there as the muscles of hand. And this is the thing for which I am teaching you from that time. This is like the important thing, so muscles of hand. Nowadays, many questions are coming from the muscles of hand. Okay. So let us now discuss. Okay. Let us now discuss here right now, guys, about the muscles of hand right now, guys. Now everyone here right now, guys. सब लोग यहाँ पर सुनिए ध्यान से. Bharat, we have already discussed that 2-3 times today in the very beginning of the class. Also, I told. And yesterday we have discussed now all the muscles in anterior compartment of the forearm by ulnar and median and all this. Muscles of hand also by ulnar and median. Chalo sir. And now the ulnar nerve is going to enter into the hand right now. Ulnar nerve कहाँ पर enter होता है? Hand में enter होता है. ठीक है जी? हो गया? Now the moment the ulnar nerve will enter into the hand, in hand it will be supplied to which muscles? Muscles of hand जो होते हैं उनके नाम आपको पता है कि नहीं है? Do you know the names of the muscles of hand? हाँ या ना? If you first know the names, then you can decide कि ulnar nerve किसको supply करेगा, है ना? So that's very sincere answers. अच्छा चलो, name don't worry about that, sir. I'll make you perfect in the names. Okay. Now first of all, just tell me about the number right now, guys. At least do you know how many muscles do you have in the hand? How many muscles do you have in the hand? Remember, there are totally 20 muscles in hand, sir. There are totally 20 muscles in hand, and all the 20 muscles of the hand we are going to become perfect now. ठीक है? तो पहले हम पढ़ेंगे all 20 muscles of hand, and then after that we'll decide कि out of that 20, how many will be supplied by ulnar nerve and how many will be supplied by median nerve. Ulnar nerve and median nerve. Is it okay? तो चलो यहाँ देखो sir. And now for 2-3 minutes, nothing to write down, guys. First observe here everyone. सब लोग यहाँ पर देखिए and try to learn the technique, how to learn all the 20 muscles of hand right now, sir. And I want all of you to become expert in this one. Questions are coming from the muscles of hand only. So please concentrate here and follow my technique here. How to remember that one, sir. Okay. First of all, you are going to remember that this group of muscles which are present below the thumb के नीचे, this group of muscles is known as thenar muscles. Thenar. And this group of muscles below the little finger here, this is known as hypothenar. First point. Second point that you have to learn is that in this thenar muscles will be having the name as pollicis brevis. Pollicis brevis. What is the meaning of pollicis? Pollicis means thumb, and brevis means short, छोटा वाला, lengthwise. Okay, short muscle. इनके नाम में होगा pollicis brevis. And what about the name of the hypothenar muscle? In the hypothenar muscle, in their name you will be having digiti minimi. Digiti means digit. Digit means finger, and minimi means छोटा वाला, little finger. Understanding here? So first you are going to learn these 2 points. Point number 1, this group of muscle thenar, this group of muscle hypothenar. Second point, in their name pollicis brevis, in their name you will be having digiti minimi. And once you have learned these 2 points here right now, my dear friends, now I am going to show you certain actions of thumb, and you people are going to tell me what are the actions. Okay, na? What are the actions done by the thumb right now? Come on. And I request all of you to, you also do it practically, sir. आप लोग भी करो मेरे साथ में. If I am going to move my thumb like this here, अगर मैं ऐसे move करूँगा, tell me what is this one? Flexion, extension, abduction, adduction. Okay. Remember this one is a flexion, guys. Flexion. Okay. And now if I'm going to move my thumb away from here right now, and what is this known as, guys? This one is extension. तो ये वाला होता है flexion और ये वाला होता है extension. Flexion, extension. ठीक है, हो गया. And now please move your thumb like this. ऐसे रखो. Keep it like this. Move the thumb away from the fingers 90 degrees in this direction, in this plane. Okay. So if you move your thumb like this here right now, guys, this one is known as moving the thumb away from the fingers is nothing but abduction. What is that one? Abduction. And moving towards the fingers will be adduction. Moving away from fingers, abduction. Moving towards adduction. Understanding it? So chaliye, let me do it in this plane here right now, guys. This one is flexion, this one is extension. This one is abduction, and this one is adduction. Okay, for the last and final time, flexion, extension, and this one in the front here will be abduction, and this one is adduction. And apart from that, counting like this, counting, this will be opposition. Finger is trying to come here and you're opposing it. Opposition. इसको हम कहते हैं opposition. ठीक है जी. Now, why am I showing you all these movements of thumb, flexion, extension, and all those things? Why? Because common sense, all these movements of thumb are done by this muscles only. Which muscle? Thenar muscle. है ना? So keeping all this information in mind, now let us write down the names of the muscles, guys. Come on, start writing the names of the muscles. So muscles of hand will be number 1, thenar muscles. On the other side, you write down there as hypothenar muscles. Now in the thenar muscle, number 1, you'll be having a muscle helping in flexion, flexor. Number 2, a muscle helping in abduction, abductor. Number 3, there is a muscle helping in opposition, opponents. While writing, just don't simply copy from the screen. That action should come in your mind. Flexor, abductor and opponents. और सर ने स्टार्टिंग में क्या कहा था, इनके नाम में क्या होना चाहिए? What should you have in the name of thenar muscles? Pollicis brevis. So therefore it will be flexor, pollicis brevis, abductor, pollicis brevis, and opponents it will be only pollicis. Lovely. Understanding here? In MBBS days, people will be just sitting and just mugging कि यार इसको कैसा रट्टा मारे. रट्टा मारने का कोई ज़रूरत नहीं है. Follow my technique here. So the muscle which is helping in flexion, flexor, pollicis brevis. Abduction, abductor, pollicis brevis. Opponents, it's only opponents, pollicis. Achha, not only that, I'm done with flexion, I'm done with abduction, I'm done with opponents. What else is left out? Adduction. And for adduction, we're having one more muscle, write down the 4th one, and that will be adductor. Adductor pollicis. For adduction, you have got adductor pollicis. So these are the thenar muscles. And now, my dear friends, if you are done with the thenar muscle, hypothenar muscle will be damn easy. Pollicis brevis, pollicis means thumb and brevis means short. Pollicis means thumb, brevis means short. Now guys, once you are done with the thenar muscle, hypothenar, so it's like, time pass. Number one, number two, number three, your favorite work, copy paste. Number one is flexor, number two is abductor, and number three will be opponents. लेकिन सर ने स्टार्टिंग में क्या कहा था, इनके नाम में क्या होना चाहिए? व्हाट शुड बी देयर इन द नेम? डिजिटाई मिनिमाई. फ्लेक्सर डिजिटाई मिनिमाई, abductor digiti minimi, opponents digiti minimi, opponents digiti minimi. Number 4 will be a different one, and that one will be your palmaris. There will be palmaris muscle. Will it be like palmaris longus or palmaris brevis? Palmaris longus or palmaris brevis? Definitely it should be palmaris brevis only. It can't be longus. क्योंकि हम लोग क्या पढ़ रहे हैं? What are we learning right now, guys? We are learning muscles of hand, and in hand you can't have long muscles. है ना? It is palmaris brevis, short muscle. Done. Okay. Thank you for appreciation. Look here. So we are having the thenar muscle and the hypothenar muscle. The best way to learn is flexor, abductor, opponents. Okay, here it will be pollicis brevis and there it will be digiti minimi. Understood here? And now after that, hello my dear friends, in total how many muscles do you have in hand? 20. How many are completed? 8. How many remaining? 12. And now we are going to learn the remaining 12 muscles. Do you want to learn that? Say yes. Say yes. Do you want to learn the 12 muscles? Yes. Right down there. There will be 4 muscles which are known as lumbricals. There will be 4 muscles which will be known as interossei. Palmar interossei. And there will be 4 muscles. There will be dorsal interossei. Oh. This is the best way to learn the 20 muscles of hand. And I think you people are very good at addition. 4 dorsal interossei, 4 palmar interossei, and 4 lumbricals. 4 and 4 will be 12, and 12 plus 8 will be 20. 20 muscles of hand. Done. ठीक है? 20 muscles of hand are done, sir. क्या बात? In the easiest manner possible. And now let us add some more information here. हम लोग ना थोड़ा कुछ और information यहाँ पर add करते हैं. तो सब लोग यहाँ पर देखिए. I want every one of you to please concentrate on the meaning of interossei. Inter means in between. Ossei means bone. Osteum means bone only. Interossei means what, guys? It is in between the bones. Now what you people do is try to think it will be between which bones? Come on, tell me. It will be between which bones only? Yeah, very good. Metacarpal. Now guys, look here. We are actually dealing with the muscles of hand. In hand you are having like carpal, metacarpal and phalanges. Definitely this muscle is between what only? Metacarpal. And if this interossei muscle is between metacarpal, it is helping in moving the metacarpal closer or taking them away. My God. Moving up closer or away. And moving closer is known as adduction. adduction. Moving away is known as in adduction, and which will help in abduction. Palmar interossei will be helping in adduction. Palmar interossei will be helping in adduction. Remember the famous mnemonic as PAD, pad. And dorsal interossei will be helping in abduction. And remember that as DAB. So each and every medical student remember the same mnemonic, pad and DAB. Palmar interossei is helping in adduction, and dorsal interossei will be helping in abduction. Palmar, adduction. Dorsal interossei, abduction. Wow. And what about the lumbricals right now, guys? Lumbricals will help in what? Lumbricals, very easy. L for lumbrical, and please make your hand like L shape. L for lumbricals, and please make your hand like L shaped. ऐसे, okay ना? If you make your hand like this, this is like L shape here, L, है ना? And this is done. Metacarpophalangeal. This is metacarpophalangeal. Okay, it is helping in flexion of the metacarpophalangeal. And this is interphalangeal. This is helping in extension. So flexion of this metacarpophalangeal joint and extension at interphalangeal joint. Okay. So please write down there. Lumbricals are helping you in making your hand like L shape. Babaji ka ठुल्लू. Okay. तो लिखो वहाँ पर lumbricals help in flexion of metacarpophalangeal joint, extension of interphalangeal joint. Wow. So much of information that you have to remember here right now, guys. And I think it's all made easy. ठीक है? हो गया? Are you done? Now, once you are done with all this information regarding the muscles of hand, right now, my dear friends, this much information is more than enough. अब आ जाइए वापस. Welcome back to our topic right now, sir. What is our topic that we are learning right now? We are learning ulnar nerve. What are we learning? Ulnar nerve. Ulnar nerve is not supplying to any muscles in arm. हो गया. 1.5 muscles in forearm. हो गया. And now the ulnar nerve is entering into hand. And now first observe here, look at me, then afterwards we'll see on the screen. If this is our hand here right now, guys, are you able to see my hand there? If this is our hand here, ulnar nerve is going to enter from medial side. If the ulnar nerve is coming from the medial side here right now, will it supply to thenar muscle or hypothenar muscle? Hypothenar muscle. So already you know it will be supplied to hypothenar muscle, and you people are very much perfect with the names of that. Achha, not only the hypothenar muscle, we are having how many lumbricals? 4. 1, 2, 3, 4. From lateral to medial. Lateral to medial. 1, 2, 3, 4. Remember, ulnar nerve is coming from here. Therefore, it will be supplied to 3rd and 4th lumbrical. Okay. And then ulnar nerve is going to take a turn. And after taking a turn, it is supplying to all interossei. The 4 palmar interossei and 4 dorsal interossei. Then it will go on the other side. On the other side, it will be supplying to the 4th muscle I wrote separately in capital letters, adductor pollicis. That's an exception there. Is it okay? चलिए एक बार फिर से repeat करता हूँ मैं. Ulnar nerve is going to come from the medial side. Okay, come on, come on. You also apply on your hand. Learn practically. Come on. Okay. So hand here right now, ulnar nerve is coming from here. And it is going to supply to hypothenar muscle, 3rd and 4th lumbrical, all interossei. On the other side, it is going to supply to thenar. Which thenar? Adductor pollicis. So let us now mark all the muscles here right now, sir. Hypothenar muscle, flexor digiti minimi, abductor digiti minimi, opponens digiti minimi, palmaris brevis. Lumbrical number 3, lumbrical number 4 only, and then 4 palmar interossei, 4 dorsal interossei, and adductor pollicis. Wow. Each and every marked muscle in the red color is supplied by ulnar nerve. So these are the muscles supplied by ulnar nerve in hand. Are you all done? Can you please count and tell me how many muscles out of 20 muscles are supplied by ulnar nerve? Ulnar nerve is supplying to how many muscles? Come on. Please count properly. There are totally 15 muscles, guys. कैसे? 1, 2, 3. These 3 are left out, and 2 lumbricals are left out. So 3 plus 2, this will be 5. So remaining will be 15. 15 muscles of hand are supplied by ulnar nerve. So that is why ulnar nerve is actually the dominant nerve in the hand. Which is the dominant nerve in the hand? Ulnar nerve. And because ulnar nerve is the dominant nerve in the hand, okay, it is controlling many fine movements of the hand. And those fine movements are required for playing musical instruments. That is why ulnar nerve is said to be musician's nerve. Musician's nerve. Ulnar nerve complete. समझ में आ रहा है? And nowadays our students are going to write on the exam, MC exam, and after coming back from the exam, new dialogues. कि सर पता ही नहीं चला कि क्वेश्चन कहाँ कहाँ से आया था, है ना? सर हवा ही नहीं लगी कि क्वेश्चन कहाँ कहाँ से आया था. अगर नहीं पढ़ के जाओगे तो क्वेश्चन कहाँ कहाँ से आया कैसे पता चलेगा? क्वेश्चन यहाँ से आया था. So they're asking many questions from muscles of hand. और हमको muscles of hand पता ही नहीं है. How to learn 20 muscles? Don't know. रट्टा मारो भूल जाओ. So please don't do that. Follow my method. It's easy now. Is it okay? Now once you're done with the ulnar nerve, now let us learn about the median nerve and the radial nerve in 2 minutes. It will be done. What is another name of the median nerve? It is also known as laborer's nerve. Median nerve is also known as laborer's nerve. In any nerve, what is the first thing to write down? Origin. What is the origin of the median nerve? So it is going to originate from both lateral cord as well as medial cord of brachial plexus. Okay. Now, what will be the root value of this median nerve? Because of the lateral cord here, the root value will be C5, C6 and C7. And because of the medial cord, the root value will be C8 and T1. ठीक है? अगर आप ध्यान से देखोगे, because of the lateral cord, the root value will be C5, C6 and C7. And because of this medial cord, the root value will be C8 and T. So in short, all the root value. Rashid will be having a break in another 5 to 10 minutes. Okay, don't worry. So lateral cord and the medial cord of the brachial plexus are going to form your median nerve. After the origin, the next thing will be the supply. Yeah, come on, you people help me right now. It supplies to which muscles? In the arm. Will median nerve supply to any muscles in arm? No. How can you say no? Anterior compartment musculocutaneous, posterior compartment radial. आसान हो गया हमारे लिए. It's easy now. In the forearm, will it supply to any muscle? Except which muscles? Except medial 1.5 muscle. All muscles of the anterior compartment of the forearm will be supplied by median nerve, except medial varna. Varna is supplied by ulnar. हो गया. Arm हो गया, forearm हो गया. Welcome to hand right now, guys. In the hand, already muscles are done. Whatever muscles are remaining right now. What muscles are remaining right now? The thenar muscles. Which thenar muscles will be supplied by the median nerve? Flexor pollicis brevis, abductor pollicis brevis, and then opponens pollicis. Not only that, even lumbrical number 1 and lumbrical number 2. So everything wrote there in yellow color is supplied with a median nerve cell. Median nerve हो गया. Come on, are you all done? Please confirm me. मैंने आपको स्टार्टिंग में ही प्रॉमिस किया था अल्नार नर्व यू हैव टू लर्न इन डिटेल. वंस यू आर डन विद अल्नार नर्व थोड़ा सा समय लेगा, उसके बाद में तो सब आसान आसान. आर यू डन विद द मीडियन नर्व? चलो, इफ यू आर डन विद द मीडियन नर्व, नाउ वेलकम टू द लास्ट एंड फाइनल वन थिंग. राइट ऑन द हेडिंग एज रेडियल नर्व. राइट, in any nerve the first thing to write down is origin. Posterior cord of brachial plexus. What is the mnemonic for the posterior cord? Lunar. And here R stands for radial nerve. In the bracket you write down the root value of the radial nerve, C5, C6, C7, C8 and even T1. Okay, radial nerve. Okay, origin हो गया sir. Then after the origin, write down there is the supply. Supplies to which muscles? आप सबको पता है, मुझे पढ़ाने का ज़रूरत ही नहीं है. It is gonna supply to the posterior compartment of arm, and radial nerve is also gonna supply to the posterior compartment of forearm. हो गया. Radial nerve will be supplied to the posterior compartment of arm muscles and the posterior compartment of forearm. Sir, I want to even learn. Yes, easy. Posterior compartment of arm, you will be having only which muscles, guys? Triceps. Posterior compartment of arm, only you have to learn what, guys? Triceps. Tri means 3, ceps means heads. Triceps, 3 heads. There will be one long head of triceps. There will be a medial head of triceps. And then there will be a lateral head of triceps. So there will be a long head of triceps, there will be a medial head of triceps and lateral head of triceps. There will be 3 heads of triceps. Okay, that's the only muscles in the posterior compartment of arm. Now what are the muscles in posterior compartment of forearm? Just remember, in the posterior compartment of forearm you will be having extensors. Which muscles? Extensors. Done, sir. Ready now? So my dear friends, from today onwards you are going to remember in this manner. So आज जो हमने क्लास स्टार्ट किया था राइट एट 6 o'clock in the evening, 6 PM, 6 to 8 o'clock right now, sir. 2 घंटे में we are done with all the major nerves and the most important thing, the most important part. Is it okay? Musculocutaneous nerve, the axillary nerve, the radial nerve, ulnar and median. Done, sir. Perfect. Are you okay with this one here? Are you all done? अगर ये हो गया है, Palmaris brevis is also supplied by ulnar only. It is a part of hypothenar. Hypothenar, all muscles are supplied by ulnar. Median वाला पेज, median nerve, I have erased that, sir. वो चला गया अभी. क्या चाहिए आपको median nerve? Extensor muscle, all the extensor muscles here. Extensor digitorum profundus, superficialis, all extensors which are helping in extension. ठीक है? चलो sir. Now the next one. Now the next one that we have to learn here is what will be the applied aspect of this one, guys. So right on the side there is the applied aspect. अब यार देखो आपको ना कितना मजा आएगा पढ़ने में, ठीक है? In some people, unfortunately, what will happen is that ulnar nerve यहाँ से आ रहा है ना, ulnar nerve is coming from here, and that ulnar nerve will be injured here. Come on everyone, hello, I want you people to apply right now. You have to apply. मेरा काम हो गया, मैंने पढ़ा दिया आपको. Now come on, as a doctor, apply. Ulnar nerve will be present here, passing from the medial side. Ulnar nerve damage, injured, cut, injury हो गया. So all the 15 muscles in the hand gone. Now the hand will become something like this. ऐसे हो जाएगा. Now tell me, is it a claw hand? Yes. But is it a complete claw hand or partial claw hand? Partial claw hand. And what is the nerve involved in the partial claw hand? What will be the nerve involved in the partial claw hand? Yes, it is ulnar nerve. Okay, so nerve involved. So partial claw hand, the nerve involved will be ulnar nerve. Number two, आप मुझे ना अप्लाई योर कॉमन सेंस एंड टेल मी, अगर मुझे कंप्लीट क्लॉ हैंड चाहिए तो कौन सी वाली नर्व इन्वॉल्व होगी? अल्नार नर्व इंजर्ड, 15 muscles are gone, partial claw hand. Median nerve is injured, 5 muscles are gone, then there will be complete claw hand. Acha. So therefore, the complete claw hand, both ulnar nerve plus median nerve are involved. Lovely. Number 3. Now, what is the nerve that is involved in wrist drop? Wrist drop. Okay. Now, what is the nerve involved in wrist drop? Now, everyone here right now, guys. Look at my hand here right now. Hand, I'm able to keep it straight like this because of which muscle? The flexor muscle or extensor muscle? I'm able to keep my hand straight here. Is it because of flexor or because of extensor? Because of extensor. Extensor muscles are going to keep my hand straight like this. Now tell me, extensor muscles will be supplied by which nerve? Radial nerve. Radial nerve injured. Extensor muscles gone. I'm not able to keep my hand straight like this. My wrist will be dropped. My hand will become like this. A patient will come with a hand like this. Wrist drop. And what is the nerve involved in wrist drop? Radial nerve. Asan hai. So the nerve involved in the wrist drop will be radial nerve. Okay. Now the next one, number 4, will be Saturday night palsy. Now what is the nerve involved in the Saturday night palsy right now, guys? See, to understand this one, Saturday night palsy, you need to understand why the name is given like this. Why is the name given like this? In the olden days, people used to drink on the weekends. Drinking. So people used to drink on the weekends and Saturday nights. So suppose they are drinking in the Saturday night, must mein full tully, and after drinking, they are just lying on the chair itself. They are not even, going back to their bedrooms and sleeping. They are just lying on the chair like this. And when they are lying on the chair like this here right now, look at my arm here right now. My arm is resting on the chair. And today only, in the beginning of the class, we have drawn the diagram. If this is my arm, humerus bone के shaft के पीछे से कौन सी वाली nerve pass हो रही है? Spiral groove. What is that nerve? Radial nerve. And that radial nerve will be compressed. The whole night, and that fellow will be having a palsy. That is why doctors kept the name as Saturday night palsy. So what is the nerve involved in Saturday night palsy, guys? Again, radial nerve. Wow, beautiful. So all the information that we have, learned today, this is how it is useful, guys. No need to mug up at all. तुक्का लगाने की और रट्टा मारने की जरूरत ही नहीं है. Apply the concept. अगर अल्लाह nerve गया, partial claw hand. Median nerve भी गया, complete claw hand. Then radial nerve is gone, wrist drop. And radial nerve in the spiral groove gone here, then it is Saturday night palsy. Are you okay with this one here right now? And that completes all the major nerves here in one session. Done. Okay. So I think this was useful to you people to remember all the muscles and everything easily. है ना? तो अभी हम एक काम करते हैं. We'll take a small break here right now for 20 minutes. We'll take a break, and after the break, we'll continue with the remaining topics. Remaining, you have got some miscellaneous topic, and upper limb topic will be done. Okay? So take a break for 20 minutes. We'll get back after 20 minutes. Right now, guys. So before the break, I taught you about all the 5 major nerves and whatever muscles that are supplied by them 5 major nerves. We're done with that. And now what we're going to do is that we are going to see the sensory supply by nerves. So you are done with the musculocutaneous nerve, you are done with the axillary nerve, ulnar, median, and the radial. All the 3 nerves are done. And ulnar, median, and the radial, all these 3 are going to supply to the skin covering your hand. Anything supplying to the skin will be sensory. So let us learn about the sensory supply right now. So please write on the heading as sensory supply. Fine. So we are going to draw the right hand right now. First we are going to see the palmar surface. This is the palmar surface, and then we are going to see the dorsum of the hands. So right hand first, let us see the palmar surface first. So imagine this one to be the little finger, the ring finger, the middle finger, and the index finger. And then you have got the thumb here right now, something like this. Now this one here will be the palmar surface. Now how to identify that this one is the palmar surface? Just draw the lines like this. And my dear friends, on the palmar surface, the skin covering the medial 1.5 digit, this one, the skin covering the medial 1.5 digit. So the skin of medial 1.5 digit, this will be supplied by which nerve? Ulnar. Okay. So the skin covering the medial 1.5 digit will be supplied by ulnar nerve. Ulnar nerve will take care about that. And it is like common sense. Why? Because ulnar nerve is actually coming from which side only? Medial side. And what about the lateral? The lateral 3.5 digit. The lateral 3.5 digits. The skin covering that will be supplied by the median nerve. Why? Because the median nerve is coming from the lateral side. Done. So on the palmar surface, the medial 1.5 digit will be supplied by the ulnar nerve, and the lateral 3.5 digit will be supplied by the median nerve. That is very easy. So in your MCA exam nowadays, you know, they're giving like clinical questions and all, and in the clinical questions they're giving, there is a loss of sensation, the lateral, 3.5 digits. The person is not able to sense anything on the lateral 3.5 digit. That means if he is unable to sense on the lateral 3.5, which nerve is injured? That will be obviously median nerve. And if the person is unable to sense in the medial 1.5 digit, then there is nothing but the injury to the ulnar nerve, something like that. So with that loss of sensation, you can easily decide the nerve involved. Now we are done with the palmar surface. चलिए sir, इसी right hand को हम उल्टा करते हैं. Let us just see the dorsal surface right now. Let's see what will be the supply on the dorsal surface. Should I remove this? Come on. Now let us turn the right hand. Now let us see the dorsal surface right now. Dorsum of the right hand. So imagine this one to be the index finger, the middle finger, the ring finger, and the little finger. And here imagine this one to be your thumb this side, and here it is. Now this one will be the dorsal surface. How to identify that this one is the dorsal surface, guys? For that you just draw the nails here. Now on the dorsum of the hand also, what is going to happen here? Medial 1.5 digit. This one, guys. Medial 1.5 digit. The skin covering the medial 1.5 digit. This will be supplied by ulnar nerve only. The skin covering the medial 1.5 digit is supplied by ulnar nerve only. Now apart from that, what about the remaining part, guys? Remaining 3.5. Now here you need to be really careful. Till here it's easy, every student will understand. Now starts the confusion. Lateral 3.5 digits, only the distal phalanges, not the complete, only distal phalanges. Okay, so phalanges will be having like 3 of them, the proximal, intermediate, and distal. So in this phalange, in this digit, you'll be having proximal, intermediate, and distal phalanges. So write down there, lateral 3.5 digits distal phalanges. Lateral 3.5 digit distal phalanges, all of that will be supplied again by which nerve only? By median nerve only. Again it is supplied by median nerve only. And whatever I have not highlighted here right now, guys, everything else will be taken care by radial nerve. That's all. So you have to be really careful with the dorsum of the hand. Medial 1.5 digit is supplied by ulnar nerve only, no problem with that. But the lateral 3.5 digit distal phalanges will be supplied by median nerve. Remaining everything will be by radial nerve. Hope it is done. So I think recently, last exam only, there was a question. A person has got the loss of sensation on the medial 1.5 digit. So which nerve is involved, guys? Ulnar nerve. So in the last December exam, there was a question like that. I got a feedback from some students. Okay. Now the next one, guys. Once you are done with this one here, this completes our entire concept of major nerves. Okay. Distal phalanges, I told you, right? You'll be having phalanges this here, right? Now fingers, the proximal, the middle, and the distal phalanges. Distal phalanges will be only. I have not highlighted the nails here right now. Why? Because you all know the nails will not have any sensation. So there is no sensory supply to the nails there. Is it okay? Distal phalanges, only the nail beds. Sure. Now once we are done with all these things, guys, so we are done with all major nerves, all the 5 major nerves. Now let us move towards the next concept here right now in the upper limb. So to be like really frank to it with you people, now the most difficult part of the upper limb has been completed right now, guys, and from here onwards we'll be having like easy stuff in that. Is it okay? So the brachial plexus, the 5 major nerves, and all that part has been completed right now. Now let us start with the easy stuff. And the easy topic, the first topic that we are going to learn is about the blood supply to the upper limb right now. See, first of all, try to learn the concept here right now. The blood supply to the upper limb will be by subclavian artery. There will be artery here below the clavicle, subclavian artery. And subclavian artery will enter into axillary artery. Axillary artery will enter into arm, brachial artery. And that brachial artery will come into the cubital fossa. In the cubital fossa, it is going to divide into radial and ulnar artery. And that radial artery and ulnar artery will continue, and they are going to form the palmar arches. So it's like only one artery, but uska naam kya hota jayega? Badalta jayega. Subclavian becomes axillary, axillary becomes brachial, brachial is going to divide into radial and ulnar, so and so. So therefore, out of all these arteries, which is the important artery that you have to learn for your MCA exam, it's only the axillary artery that we have to learn for our MCA exams. Okay? Axillary artery. So now what you do is, please write on the heading there as axillary artery. Axillary artery. Okay? So write down this, first point, it is the continuation of, come on, apply the common sense and tell me, axillary artery is the continuation of, axillary artery will be continuation of, yes, very good, it is a continuation of subclavian artery. Very good. And number 2, write down there, second point, it continues as brachial artery. So axillary artery is the continuation of the subclavian artery, and it will continue as the brachial artery. Fine. Now the next thing that we have to learn is the extent. So, like it is a continuation of subclavian and all those. Very good. But I want the exact landmark. What is the exact landmark? So please look at this diagram here right now once, guys. This will be the subclavian artery here, and it will be up to the outer border of the first rib. This is your first rib there, and up to the outer border of the first rib will be subclavian artery, and from here begins your axillary artery. Follow that. Up to here, axillary artery will continue up to the lower border of teres major, and from here begins your brachial artery. Okay, the axillary artery is from where to where, sir? From the outer border of the first rib up to the lower border of teres major. Okay, so लिखो sir, write down there. It extends from outer border of first rib to lower border of teres major. So axillary artery will be extending from outer border of the first rib to the lower border of teres major. Done. Now after learning this one here right now the next point to learn here right now is, again we'll come back to the diagram here right now, guys. Now in this diagram, this is like rib number 3 here, then this is rib number 4 here, and this is rib number 5 here. And from the rib number 3, 4 and 5, you can clearly see that there is a muscle beginning here. And this muscle bellies will combine together and they are going to get inserted onto the coracoid process. So if you just try to apply this diagram on our body, rib number 3, 4 and 5, it's going and getting inserted onto the coracoid process here. Yes, it is present here in this region. What is this region? Pectoral region. What is the name of the muscle? Pectoralis. But the problem is pectoralis muscle will have like pectoralis major and minor. So ये कौन सा वाला है? This muscle is actually the pectoralis minor, a smaller one, pectoralis minor. And now, why am I telling you about this muscle suddenly here? Our topic is axillary artery from here to here. Suddenly, why I'm telling you about this muscle here? Why? Because of this pectoralis minor muscle, our entire axillary artery is divided into 3 parts. I am able to see a part of the axillary artery before the muscle से पहले, and that will be the first part. There is a part of the axillary artery behind the muscle के पीछे, that is the second part, and there is a part of the axillary artery after the muscle, and that will be the third part. ठीक है? So the axillary artery is basically divided into how many parts? There will be like 3 parts, and it is divided into 3 parts by pectoralis minor. What is that? Pectoralis minor. ठीक है? So please write down that as the next point, guys. Axillary artery into 3 parts by pectoralis minor muscle. So this is something really important. So this is all the the important things that you have to remember. They can be asked as like questions. Okay, na? So which muscle is dividing the axillary artery into 3 parts? It is pectoralis minor muscle dividing the axillary artery into 3 parts. It is from outer border of the first rib to the lower border of teres major. Continuation of subclavian artery, and it will continue down as the brachial artery. Done. Now once you are done with all this introduction wala part, now the next thing that you have to learn, it's an artery. Artery will always give branches. So now we have to learn what are the branches given by axillary artery. There is a beautiful symmetry here. First part will give 1 branch, second part will give like 2 branches, and the third part will give 3 branches. So axillary artery, first part will give 1 branch, second part will give like 2 branches, third part will give 3 branches. Keep on writing with me. First part. The first part will give superior thoracic artery. Done. Second part will give two branches. One will be the lateral thoracic artery, and another one will be the, you know, uh, thoracoacromial artery. Thoracoacromial artery. And finally the third part will give you like three branches. One will be anterior circumflex humeral artery, posterior circumflex humeral artery, and finally the subscapular artery. See, you people just write down this one right now. I'll tell you the method to remember that. How to remember, I'll tell you. First you note down. लिख दिया आपने? डन. Now once you are done with the writing work, now the easy way to remember this one is, okay, what you got to do here is that this diagram, this diagram of the axillary artery, you need to apply on your body. First part will be here, somewhere here only. Second part will be here, and the third part will be below here. So the first part, second part, third part. First part, second part, third part. Now guys, first part is giving a branch, and it's very easy to remember. This is my thorax. Above the thorax, superior thoracic artery. That is why, what is the branch given by the first part? Superior thoracic artery. Done. Similarly, the second part is a little bit lateral away here. It is giving a branch, lateral thoracic artery and thoracoacromial. There is acromial process here, thoracoacromial artery. And finally, the third part is coming down here, and the third part is giving one branch in front of the humerus and one branch behind the humerus. Anterior circumflex and the posterior circumflex. And finally, the third branch is actually going down to the scapula there, subscapular artery. What is the name of that? Subscapular artery. So therefore, my dear friends, these are the branches given by axillary artery, and this is the way how you remember that. Okay? That is the easy way to remember. So first part will be just above here, superior thoracic artery. Second part will be like lateral thoracic and thoracoacromial, and third part below, anterior circumflex humeral, posterior circumflex humeral, and then the subscapular artery. Now there is one MCQ possible here right now. Out of all these branches, which is the largest branch, guys? Write down this one is the largest branch. That is the largest branch. Subscapular artery is the largest branch of axillary artery. Done? हो गया? Now after this, I think there is not much to remember here right now, guys. Axillary artery will continue to brachial artery. Brachial artery will come in cubital fossa and divide. Radial ulnar. Nothing to learn here. No question is being asked. And now that radial and ulnar artery will enter into the hand, and they are going to form palmar arches. So please directly write down the heading there as the palmar arches. Now how many palmar arches do you have got? You have got like two palmar arches. Number one, there will be a superficial palmar arch. There will be a superficial palmar arch. And number two, there will be a deep palmar arch. There will be a superficial palmar arch, and then there will be a deep palmar arch. And the only thing that you need to decide here is that, okay, which arch, palmar arch will be formed by which artery. And the good thing here is that there are only two options here right now. Superficial and deep palmar arch, they are formed by which artery, whether it is ulnar artery or radial artery. Only two options. So remember, superficial palmar arch, it is formed by ulnar artery And deep palmar arch, this one will be formed by radial artery. That will be formed by what, guys? A radial artery. Okay. And to avoid the confusion for long term, for long term, how to remember? Remember, look at the spelling there, sir. Ulnar artery and the radial artery, whichever has got the D in that, radial artery, it is going to form the deep palmar arch. That is the best way to remember. Understanding? So radial artery is going to form deep palmar arch. Whereas the other one, that is the ulnar artery is going to form the superficial palmar arch. Is it okay? So that's all done. So this is the information that you have to remember about the arterial supply. More than enough. चलो sir, आगे बढ़ते हैं. Let's go to the next topic. The next topic, I told you, guys, it's all about learning the major nerves properly. एक बार ये major nerves complete हो गया, तो everything is easy. Is it okay? Next topic, all these are like small topics. Next topic is cubital fossa. Now in anatomy, we all know fossa means depression. Now what is cubital fossa? Definition लिखो sir. Cubital fossa, it is a triangular depression. अच्छा, it is a triangle shaped depression in front of elbow joint. Cubital fossa will be a triangle shaped depression in front of the elbow joint. Now guys, whenever you have like triangle, rectangle, whatever shapes you have, the first thing that you have to learn in anatomy will be the boundaries. Okay. So what is the boundaries of this cubital fossa? Look at this one here right now. This is my elbow joint here right now. And right in front of the elbow joint, you are able to see a triangle shaped depression here. Lateral epicondyle, medial epicondyle. Join the two lateral and medial epicondyle with an imaginary line. And that is going to form the base. And medially you will be having one muscle, pronata teres, and laterally you will be having a muscle that will be the brachioradialis. Is it okay? So fine. Let me show you this in the picture here right now, guys. Cubital fossa, lateral epicondyle, and this one is the medial epicondyle, and this is the base. Imaginary line joining these two is going to form the base. Fine. And medially there will be a muscle here right now, and that muscle will be pronata teres, and laterally there will be a muscle here right now, and that muscle will be brachioradialis. And in between these three, there will be a triangle shaped depression here, and that triangle shaped depression is said to be the cubital fossa. What is that one, guys? That one is cubital fossa. Understanding here right now? So simple. So let us write down the boundaries right now. Base will be formed by imaginary line joining lateral epicondyle and medial epicondyle. Medially you will be having a muscle. And what is the muscle on the medial side? Pronata teres. And then laterally you'll be having a muscle, one more muscle on the lateral side will be brachioradialis. Now apart from that, in MCA exam they have even asked the floor also, guys. What is forming the floor of the cubital fossa? What is forming the floor of the cubital fossa? The floor of the cubital fossa will be formed by two muscles. The one muscle that you already know, the three muscles, coracobrachialis, biceps and brachialis. What is the muscle here? Brachialis. And one more muscle here will be supinator. And these two muscles are found in the floor of the cubital fossa. So the floor will be formed by number one muscle, that is brachialis muscle. And number two, it is formed by supinator muscle. Floor will be formed by brachialis muscle and the supinator muscle. Done? These two muscles. Now once you are comfortable with the boundaries, the next thing that we need to learn is what about the contents. Contents of cubital fossa are at most important. Now please write down the setting there as the contents. Number one content in the cubital fossa will be median nerve. There is a nerve passing from here. Obviously, what is the name of the nerve here right now, guys? Median nerve. Median nerve is going to pass from here. Apart from that, मैंने ना आपको अभी अभी पढ़ाया है just after the break. There will be which artery coming here in the cubital fossa? Brachial artery. And after coming in the cubital fossa, the brachial artery will be dividing into two branches, the radial artery as well as the ulnar artery. So it means that all these three arteries are also content. ठीक है? Sir, why are you people are not writing along with me? Floor is actually formed by two muscles, brachialis muscle and supinator. I'm telling you so slowly, आराम से बता रहा हूँ मैं. What is happening is after writing this, I'm actually erasing that. It's not there in the previous slide. नहीं है. It's erased. Supinator muscle and the brachialis muscle. Okay. Then the next one will be, yes, the median nerve हो गया. You already done with the brachial artery coming here. It is going to divide into radial artery and ulnar artery. Okay, all these three are present there. And number three, you already know. Yes. Which tendon? Biceps brachii tendon. The tendon of biceps brachii. There will be a tendon in the cubital fossa, the tendon of biceps brachii. And number four, there will be one more nerve present here. Obviously, which nerve, guys? Radial nerve is a content here. Which nerve? Radial nerve. How come radial nerve is coming here right now? Yes, right from the beginning I'm telling you. The radial nerve is going in the spiral groove, taking a turn and coming here. And after coming here, the radial nerve is a content of the cubital fossa. Can ulnar nerve be a content? No, not at all. Ulnar nerve cannot be a content क्योंकि ulnar nerve कहाँ से pass होता है? Ulnar nerve is going to pass behind the medial epicondyle. Today we have drawn the diagram. Medial epicondyle के पीछे. So if it is behind the medial epicondyle, it cannot be in front of the elbow joint. It cannot be in the cubital fossa. So these are the contents of the cubital fossa: median nerve, brachial artery and its branches, biceps brachii tendon. And nowadays they are asking in depth in the MC exam, radial nerve, which branch of that one? Is it like deep branch or superficial branch? Remember, this will be the superficial branch of the radial nerve. And that's the reason why most of the MBBS students love to remember the mnemonic MBBS. So what are the contents of the cubital fossa? MBBS. Median nerve, the brachial artery and its branches, the biceps brachii tendon and the radial nerve. These are all the contents of the cubital fossa. Now let us see all these contents here in the diagram. Now in this diagram here, I am able to find that there is a yellow colored nerve which is coming from here, and this nerve will be median nerve. Then there is a red colored artery here right now, guys, and this will be the brachial artery, and you can clearly see it's coming and dividing into radial ulnar. This muscle here will be the biceps, but its tendon is located here, biceps brachii tendon, and I can clearly see that this nerve is coming from behind here right now, and this will be radial. Which branch of the radial? Superficial. And now if these are the contents, guys, look here, I told you what is the mnemonic? MBBS. I think that will help you a lot, not only in remembering the content, even in order. Okay, all the structures are arranged in the same order. MBBS. So median nerve, the brachial artery and branches, and then the biceps brachii tendon and the superficial branch of radial nerve. All these are arranged in the same order. From where to where? From medial towards the lateral. Medial to lateral. Is it okay? Now please welcome back here right now, and in the notes you write down there, it's arranged in the form of MBBS from medial to lateral. Done. So that is about the cubital fossa. Triangle shape. You got to just learn the boundaries, and you have to learn about the branches. The boundaries and the branches. Done. Okay. And now once this is done here right now let's almost we are almost like coming to the end right now, guys. Now let us discuss about this, the carpal bones and the carpal tunnel part and all those things. Okay, some 2-3 concepts are left right now. We'll do that and we'll finish it off. Fine. Now first you write down the heading there as the carpal bones. Carpal bones. But sir, median nerve is on the lateral side. So how come median nerve medial to lateral? Median nerve is not on the lateral side, my dear friend. In the cubital fossa, the median nerve will be on the medial side only here. And once it is moving forward in the forearm, then it will go towards the lateral side. Understanding here? So we are actually speaking about which level that is important. We are in the cubital fossa, so medial side mein hoti hai. And further, it is going to move towards the lateral side in the forearm and the hand. So that is whatever you are telling, that is in the hand and the forearm. Okay, not at the level of cubital fossa. Done. Next one, carpal bones. How many carpal bones do you have, guys? You have got totally 8 carpal bones. I hope all of you know that the 8 carpal bones are arranged in 2 rows. If you see my hand here right now, there will be 4 carpal bones in proximal row and there will be 4 carpal bones in distal row. 4 in proximal, 4 in distal. Okay? And that's the reason why you have to remember the names of all the 8 carpal bones in order, that too in 2 rows, the proximal row and distal. तो हम एक काम करते हैं, let us make a block diagram of the hand. Carpal, metacarpal and the phalanges. Just let us make a schematic diagram, block diagram. So first of all, the proximal row, you'll have your scaphoid bone and then followed by lunate and then triquetrum and then pisiform. Please draw the diagram quickly along with me. Scaphoid, lunate, triquetrum, pisiform. Trapezium, trapezoid, and then capitate and then hamate. I will make you write down the full names also afterwards. Abhi ke liye exactly draw as I'm drawing. Don't worry about the full names. So this is like proximal row and that is distal row. After the carpal bone, you'll be having like metacarpals, and metacarpals will be the first metacarpal for thumb, second metacarpal for index finger, third metacarpal for the middle finger, then the fourth and the fifth metacarpal. And once you are done with the metacarpal, then you'll be having the phalanges. There'll be first like 3 phalanges in every digit, but there'll be only like 2 phalanges in thumb. So this is like, just a schematic diagram of your hand, sir. So draw it quickly right now, sir. Please be very quick. I'm going to remove that. Now once you are done with all these 8 carpal bones, we'll do one thing here. Let us write down the names of all these 8 carpal bones in full form. Okay, so below this diagram, start writing now. This diagram ke niche likho. So I'm going to remove this diagram, guys. It will no more be available. Now start writing, sir. So first of all, you'll be having like scaphoid, then lunate, then you have got triquetrum, and then you have got the pisiform. In the distal row, you'll be having first trapezium, and then there'll be one more trapezoid, and then there'll be one more capitate, and then hamate. Okay. So you can clearly see that these bones will be in the proximal row here. and this will be in the distal root. And you have to remember the names and that in the same order. And I think for that you remember the very famous mnemonic, she looks too pretty. Each and every medical student knows the same mnemonic. We also learn the same thing. She looks too pretty. When she is too pretty, why to leave her? T for try, T for to, try to catch her. Is it okay? So by this you can easily remember the sequence. She looks too pretty, try to catch her. Scaphoid, lunate, triquetrum, pisiform, trapezium, trapezoid, capitate and hamate. And once you have learned all these, carpal bones in order, once you are done with the order, now let us learn few points regarding this. Can anyone tell me which one is the largest carpal bone? Answer me, which one is the largest carpal bone? Yes, the largest carpal bone will be the capitate. Next one, which one is the smallest carpal bone? Smallest carpal bone will be the, come on, largest carpal bone is capitate. The smallest carpal bone will be pisiform. The smallest carpal bone will be pisiform or hamate or trapezoid, trapezium, lunate, scaphoid. Come on. Yes, the smallest will be actually a pisiform. Next one, most commonly dislocated. Most commonly dislocated will be lunate. Next one, most commonly fractured. That is scaphoid. And finally, one more thing. Can anyone tell me out of all the carpal bone, which is a sesamoid bone? And yes, again it is pisiform, guys. Make a note of all these things. The largest, smallest, and the most commonly dislocated is lunate, and most commonly fractured is scaphoid and sesamoid bones. Make a note of this quickly. Just now in the previous diagram, if you see, we have already made the schematic diagram, and wherever always you have your thumb jahan hota hai, that will be the lateral side. So obviously this will be the lateral side here right now, and this will be the medial side here. That's the reason why I made you draw that schematic diagram before. Okay, so that is how you can easily identify lateral and medial. And now what is the meaning of the sesamoid bone? I think when you study about the bones, ossification of bone formation. Ossification of bone will occur by two methods. One is the cartilaginous ossification. Another one will be the membranous ossification. Bones are actually formed by like two methods. One is cartilaginous, another one is membranous. Cartilaginous, membranous. But some bones will be ossifying in tendon. So the bones which will ossify in tendon, okay, the bone which ossifies in tendon, that kind of bone is known as the sesamoid bone. So the bone which is going to ossify or form in tendon is known as the sesamoid bone. So which is an example of sesamoid bone? That is your pisiform. Pisiform is one of the best example of sesamoid bone. Okay, done. Once you are done with all these things here right now, guys, next one, Next one, yeah, the next one that you have to learn here is that, okay, Prajwal, that is required for PG exams, not for MC exam. Avascular necrosis and all. हाँ यहाँ देखो. Now these are all the 8 carpal bones that you have here right now, guys. You'll be having your scaphoid here. You'll have got your lunate, then triquetrum, and then this is the pisiform, and then you'll be having trapezium, trapezoid, capitate, and hamate. All these are the 8 carpal bones. And now coming to the most important concept is that this is on the screen, whatever diagram you are seeing, it's like our hand here right now. And now you're having like 8 carpal bones. If you see from the front here right now, all these 8 carpal bones will be having a depression here right now. All these 8 carpal bones right in the front here, there will be a depression. I mean to say they're not arranged straight there. They're actually having a concavity. They're having a depression. And how or where can you appreciate the depression? आप कैसे देख सकते हो? You need to cut that. Take a transverse section. So our hand, take a transverse section here like this, and then see from here. Okay, if you see from here, your carpal bones are actually arranged in the form of a arch. So let us take a transverse section and then look at this diagram here right now. Okay, so our carpal bones are actually arranged in the form of a arch. Okay, and that is known as carpal arch. But now this carpal arch is actually closed here with the help of a band of fiber, and that is known as the flexor retinaculum. What is it known as? Flexor retinaculum. There will be a band of fiber. If you want to see, it will be something like this. Is it okay? So the carpal bones are actually arranged in the form of a depression there, okay, like an arch, and that is actually closed with the help of with a band of fiber, flexor retinaculum. And now here, because of this, there is a formation of tunnel, and that tunnel is known as the carpal tunnel. उसी को हम carpal tunnel कहते हैं. So here, whatever this tunnel that you're able to see here, this tunnel is the carpal tunnel. Beautiful. Carpal tunnel. Okay. So we are having like carpal arch covered by flexor retinaculum, and then there is a tunnel there, and that tunnel is carpal tunnel. And now guys, what do you have to learn here right now? यहाँ पर important क्या होता है? From if you just observe here, from the forearm into the hand, there are so many structures passing: nerve, artery, vein, tendons. We need to learn, okay, what are the structures which are going above the flexor retinaculum, and what are the structures which are going below the flexor retinaculum. So let me show you the actual diagram. It looks like this. Now in this diagram here, this will be the flexor retinaculum here, and here, yes, these are the structures going above, and these will be the structures going below or deep to flexor retinaculum. So what is the meaning of going deep to flexor retinaculum? It means that they are going from where only? They are going from the carpal tunnel. Understanding here right now? So we need to learn what structures are going superficial to flexor retinaculum, what structures are going deep to flexor retinaculum. And any structure which is going deep to flexor retinaculum, nothing but it is going through the tunnel, carpal tunnel. Is it okay? So यहाँ देखो, look here right now. If this is the flexor retinaculum here right now, I can see one nerve going above here. What is the nerve? Ulnar nerve. I can see an artery going here, ulnar artery, and then there is a tendon here, palmaris longus tendon. The moment you learn about these three structures, remaining everything else is actually going from below only. So where is the median nerve going? Median nerve is going from below. That means median nerve is going from where only? From the carpal tunnel only. That means hundreds and hundreds and hundreds of times this question has been asked in your MC exam. Okay, what is the nerve involved in carpal tunnel syndrome? It is your median nerve. Median nerve is the one which is going through the carpal tunnel, and that is involved in carpal tunnel syndrome. Is it okay? चलो sir, इसको हम draw करते हैं. Let's draw the diagram. So now after learning about the carpal bones, heading लिखो carpal tunnel. So please write on the heading there as carpal tunnel. And now what we are going to do is we are going to draw the transverse section. So imagine this one will be your carpal bone here right now. Trapezium, trapezoid, capitate, and here it will be hamate. Hamate bone has got this hook here, hook of the hamate, something like that. Whatever, that much detail is not required. Now this will be the carpal arch, and here you'll be having the flexor retinaculum. and here it will be split a little bit. So whatever this blue colored one I have drawn here, this one is known as the flexor retinaculum. That band of fiber is known as flexor retinaculum. Above the flexor retinaculum, there will be a nerve going here, sir. Ulnar nerve will be from here, whereas the median nerve is from here. And then there is an artery passing from here, ulnar artery. And then there is only and only one tendon from here, that is the palmaris longus tendon. So let us together write on the names right now. This will be the ulnar nerve. This will be the ulnar artery. And this here will be the palmaris longus tendon. And all the structures which are seen here are passing superficial to flexor retinaculum. Ulnar nerve, ulnar artery and palmaris longus tendon, all these are passing superficial to flexor retinaculum. ठीक है? And then there is only and only one tendon passing from here, यहाँ से, and that tendon will be actually flexor carpi radialis tendon. And remember, look at my diagram and remember it is actually passing through flexor retinaculum. That's something special about that. That is neither above neither below. अगर आप देखना चाहते हो, if you want to see, look at this diagram here right now. Now in this diagram you can see here there is one tendon which is passing from here, flexor carpi radialis. It's neither above neither below. It's actually passing through the tendon, through the flexor retinaculum. So it is the tendon which is passing through the flexor retinaculum. And just learn these two things, guys. The structures passing superficial to flexor retinaculum and the structures which are passing through the flexor retinaculum. And once you're perfect with this one, anything else is given in the exam, everything is passing deep. Deep means from where? Only through the carpal tunnel. Okay. So below here, this entire space is carpal tunnel. Everything is carpal, passing through carpal tunnel. So I have just marked here one nerve here right now, guys. What is this nerve? Yes. This is something important to remember. Median nerve. Median nerve is going from where only? From the carpal tunnel. Are you done? Are you all done? Good. And now, my dear friends, if you are done with the carpal tunnel here right now, now below this, please write down the heading there, subheading there as applied aspect. Applied aspect. Number one, what will be the nerve that is involved in carpal tunnel syndrome? Carpal tunnel syndrome. What is the nerve going to be passing from the carpal? What is the nerve involved in carpal tunnel syndrome? What is the nerve passing from carpal tunnel? Median nerve. That is why, yes, the median nerve will be involved in carpal tunnel syndrome. Very good. Number two, what is the nerve that is involved in cubital tunnel syndrome? See, cubital tunnel is that word that is used for the tunnel from where the ulnar nerve is passing. You remember cubital fossa? And you remember ulnar nerve is passing from behind here right now? Yes, it is the one which is passing from there. So the reason why I am making you write down this right now here is that why? Because in the previous many exams this questions has been asked, and I have seen every time the students, the moment the question comes in your MC exam, yes, they are not concentrating on this word. Carpal tunnel is median nerve and cubital tunnel syndrome is ulnar nerve. Take care about that. Okay. And one more question that was asked recently in your MC exam was the Guyon's canal. What is the nerve that is involved in the Guyon's canal syndrome? Again, it will be the ulnar nerve. Ulnar nerve is passing in the Guyon's canal, and that Guyon's canal will be located near the wrist. If you want to, just for the sake of remembering, cubital tunnel will be at elbow, whereas Guyon's canal will be near the wrist. So these three are like three important MCQs you have got to remember. So what is the nerve involved in carpal tunnel syndrome? Median nerve. Cubital tunnel syndrome, ulnar nerve. And Guyon's canal syndrome, again it is ulnar nerve. Are you okay? Done. So this is like, one complete concept. So right from the carpal bones and all, you have to just remember like one complete concept here right now. And we'll come to the last and final concept here right now, guys. Heading Lico, anatomical snuff box. Anatomical snuff box. Anatomical snuff box. Now what is this anatomical snuff box? Look here. Today only I taught you in our hand, thumb, flexion, and this one is extension. Flexion, this one is extension here, extension. Extend your thumb like this. And after extending your thumb here like this, guys, just observe here. Here you'll be able to find a depression. Here you will be able to find one depression here. And in this depression, you can aram se put whatever you want to put and snuffing. Okay. So therefore that is known as anatomical snuff box. And you got to remember the boundaries. Anatomical snuff box, remember, laterally there will be two tendons. Laterally there will be like two tendons. Extensor pollicis brevis. Another one will be the abductor pollicis longus. Abductor pollicis longus. Extensor pollicis brevis and abductor pollicis longus. Whereas medially you'll be having only one tendon. And that one tendon on the medial side will be extensor pollicis longus tendon. So on the lateral side, we'll be having like two tendons, extensor pollicis brevis and abductor pollicis longus. And medially there will be one tendon, extensor pollicis longus. Please make a note of that properly. Every time in the exam they are asking this question only, the boundaries. Done. And once you are done with the boundaries, guys, the last and final thing to remember here is what are the contents of the anatomical snuff box. And content, the only and only one content here will be the radial artery. A radial artery is the only and only content here. Okay, and you can clearly see that in here, this yellow colored highlighted part here is anatomical snuff box. This yellow colored highlighted part is anatomical snuff box. In that you can see the radial artery here right now. And that radial artery is the content of anatomical snuff box. Okay, fine here right now. That's all about the anatomical snuff box. ठीक है, हो गया? That's all, guys. And that completes about your upper limb topic, guys. Okay, now. So in upper limb, we are done with the brachial plexus, all the branches of that, the muscles in, arm, forearm, hand, and all the concepts related to that. Then the cubital fossa, carpal tunnel, anatomical snuff box, everything is done. And artery, axillary artery, and everything done. So, okay. And joints, I do not tell you right now. Joints I will teach you separately. We are going to study general anatomy part. Okay, general anatomy part में मैं आपको ना सारे joints एक ही जगह पर पढ़ा दूँगा. Ajay, you should already know ape thumb is nothing but the sign for carpal tunnel syndrome only. Carpal tunnel syndrome, what is involved? Median nerve. Of carpal tunnel syndrome. Ulnar nerve is actually passing behind the medial epicondyle, and behind the medial epicondyle here there will be a tunnel, and that tunnel will be actually cubital tunnel. Cubital tunnel. Is it okay? तो cubital tunnel, it is ulnar nerve involved. Done? Sure. Rahul is asking on Saturday, can we keep the class little early? So Rahul, it's actually not possible. Tomorrow Saturday, actually I'm leaving to Ahmedabad. I'm having a PG class, and after my PG class, I'll be taking the class from 6 o'clock only. So we have to follow the same time. Yeah, we'll discuss. So about the images, I'll have send you the PDF, images wala. So try to take a print of that and keep ready. And today what you do is just revise this upper limb topic. अच्छे से first you become perfect in that one, and then we'll try to label all the images tomorrow, so that you also be ready with the revision part and all. Any more doubts? Chalo then. Hope this is done, and then we'll stop here for today and we'll continue tomorrow. ठीक है ना? Tomorrow we'll continue, and I'll let you know everything about that.